highly indebted to the core committee and the executive committee for their unconditional support in arranging this conference. I'm also thankful to the Sina board and the management for this untiring and making this conference successful. I would like, at this time, recognize all the volunteers who has made this conference possible. I would like to request our core committee to please stand up and be recognized. Core committee. I would like now request our executive committee to please rise and be recognized. Our executive committee. Very important that I would like to also recognize that you all know that the entire Sina system is currently run by our Chief Operating Officer. And I would like to recognize Liaquat Khwaja for his unconditional support. There are a lot of volunteers. Time has been given behind this conference, and there are a lot of volunteers who have given us time. So thank you very much, each and every volunteer that we have put time. I will take some names. I will not be able to take all the names, but I will take few names to recognize because they have given their time and commitment the most. I would like to thank our Council General Abrar, who has been very committed in support. I would like to thank our Sayyid Sheikh, my brother, Barkat Rubani. Thank you, Barkat, for your support. And he's going to be feeding us all day, so we need to clap more. Once again, I can't miss our media. Thank you, media, for all your support that you have provided to this event. Thank you. Once again, I welcome you all to this history-making, unique conference and hope this will be beneficial to you and your family. May Allah bless you all for your services to the community. Allah Hafiz.
Let's do one more round of applause for Mr. Accompanies and Sina for bringing us here today. I don't know about y'all, but I am so excited. So anyway, now it's time to get, as we wait for Congressman Al Green, we're really getting into kind of the meat, the technical portion of today's program. So this next segment, we're really focused on discussion of specific issues. So some of these might be something that each and every one of you are really excited about or have a specialty in. Specifically COVID, social stigma, youth, and addiction. So we'll start, according to the World Health Organization, the COVID information and the impact on COVID on mental health is just the tip of the iceberg. So there's so much more to learn about the impacts of COVID on mental health. And to help us navigate some of those impacts, I'm going to invite Dr. Asim Shah to the stage to help us navigate mental health issues in the world of COVID. Dr. Asim is the professor and executive vice chair, mashallah, long introduction, long title, Division of Community Psychiatry, professor, Department of Family and Community Medicine at the Baylor College of Medicine, chief of psychiatry at Ben Taub and the Harris Health System, and finally, the director of the Mood Disorder Research Program at Ben Taub and the Community Behavioral Health Program. So please join me in welcoming Dr. Asim Shah to talk about COVID and its health ramifications.
Thank you very much. It's very hard to follow Mr. Bhai because you have said so many good things, hospital, surgery center, mental health, so I don't know what I can say here, but I may depress people with my presentation after all this positive energy. We have a great group of people as speakers, Dr. Barno, Dr. Mukadam, Dr. Basi from Michigan, great panel, so it's very exciting. So, okay, so I'm going to talk about mental health issues in the world of COVID-19. COVID came, as you all know, March of 2020. Before that, world was sort of normal and things changed. Normal became abnormal and now there is a new normal, right? I don't see anybody wearing a mask today, which is I guess good. Pandemic became sort of endemic now. People are not as worried about COVID now as they used to. People get COVID positive now, but now they're not as worried about COVID as they used to in 2020. Muslims, Islam is the third largest religion in US after Christianity and Judaism, and we have about 3.5 million people in US who are Muslims. 3.5 million people. And some estimates say that number may be even less, the number may be even more than 3.5 million. So the number could be even up to 7 million, because some people are not in the census, and some census details don't capture religion, so the number could be even higher than that. So that's one. Second is, by 2050, that number is supposed to be higher, and in Islam will be, that's projected, the second largest religion in the country. It will surpass Judaism, so it will be the second largest religion in the country. So that's the second source. The third is, in 2005, usually every year, if you see, we get people from different Muslim countries coming to US. The most people came in 2005, 96,000, followed by 2000 odd. We had a lot of people in 2009 also. And that depends on what the policies of the government are at that particular point. Does anybody remember who was the president in 2005? Bush, yes, exactly. Who said that? Good. Who was the president in 2009? Obama, yes. So, different president, different parties. Another stat about Muslims, 42% of Muslims are in the US are born here, whereas 58% are immigrants. Now, that number is very important, especially when it comes to mental health. Why? Because when you're born in a different country, you come to this country, of course, the culture can be different, the norms can be different, the challenges can be different, and that can cause in itself. Second is, Muslim immigrants come from 75 different countries, and I'm so glad we have council journalists from a lot of countries here, but 75 different countries, that's an important number, because you have cultures from many countries, you have cultures from, religion is one thing, but culture is another thing. Just having one religion is not enough to assimilate. Culture is another thing. And actually, to me, food is very important, and food connects you very easily also. But, so 75 countries, that's a big number if you think about it. So what we have seen that some Muslims with mental illness may also think that mental illness is sort of a curse or punishment. And again, that depends on culture to culture. Or where they're coming from, but they may think that mental illness may be a punishment by God, and they kind of don't want to get psychiatric illness because they think that it will be a weakness. They may go to an imam, they may go to their spiritual leader, but they may not go to a professional to get mental help. And that's the reason we want the community leaders to learn about these things today. That's one of the purposes of today's conference, actually. When you say that people are thinking that mental illness may be a curse, you need to first change that concept. You need to not only change that concept, you need to make them realize that, of course, that is not the issue. What are the warning signs and where do you get help? Now I'm going to share some stats from Institute for Social Policy and Understanding, and these are public stats on their website, and anybody can go and see to Muslims, and a lot of these things can be seen. So if you see, they did one survey in 2017 in which they found out that American Muslims are the only community or faith community which really doesn't have a majority race. We are a combination of multiple races, as you see. Muslims in this country do not constitute a one race. You cannot say that this is a religion of blacks or Arabs or Pakistanis or Indians or whites. It's a religion of every race. So that's important. Number two is, they also assessed that American Muslims experience living for 1 year through the COVID-19. A survey had about 1,700 people, and this was perhaps one of the only surveys specifically focused towards Muslims. There are many surveys in COVID, but most of the surveys were not focused towards Muslims. This was a survey focused towards Muslims. They had conflicts in the household, they were feeling more angry, feeling more down, feeling more nervous. Does anybody have any explanation why Muslims were having more negative mental health feelings than non-Muslims?
So the fact that they could not go to the masjid.
Yeah, absolutely, and that's a very important one because Muslims usually go to the mosque on Friday, and that's a big source for them to see each other and all of that. And perhaps that was the first time they were unable to go to the mosque in maybe their lifetime, right? And that was a big impact on their life. I don't think people would recall that has ever happened in their lifetime, that they were unable to go to the mosque to pray their Friday prayers. And that had a huge impact on Muslims. Some could go Fridays only, but a lot of people would go 5 times, and that was a big trauma, especially in early 2020 when everything was very different. Then you see Muslims aged 50 and older, they were less likely to report negative medical symptoms or mental health symptoms since start of COVID-19 than the others. If you see younger population, and the red one is over 50. So that is the reason they had a lot of negative impact. But again, remember, these are all hypotheses. But young people were restricted to home, not going anywhere, and that was a huge impact on them. This pandemic, which lasted 2 years and still in some ways is there, can cause mental health impacts for up to 10 plus years easily, especially in kids. And we don't need to forget that because this can cause impact for a long time, maybe even a decade, especially in kids, Calling family and friends, we call each other, that's good, that's our coping strategy, family. Then comes extra dua, which is always important, reaching to Allah, reaching to God, so extra dua, that's important, we need that too. Exercise, 57%, extra Quran, extra prayer, journaling, so all those things. One of the things Muslims did. The thing which separates Muslims from non-Muslims, I think, is the second one, which is extra dua, which is the prayers. I think the concept of prayer is unique with us. Everybody prays, but the concept of prayers is a little bit unique with us, that we have more strong connection when it comes to prayer, when it comes to the concept of connecting with God. And that helps spiritually connecting with a lot of things. So, what did we do unhealthy in terms of coping? Of course, first one I'm guilty of also, eating unhealthy food. Carbohydrates, starch. When you're at home in 2020, especially, what are you going to do? People eat unhealthy stuff, people do things like that. And gain weight. In 2020, a lot of people gain weight. Shopping online, sleeping more. Luckily, drug and alcohol was not as much of a problem, but eating and those things were problems. The problem is that we did have more mental health utilization in Muslims, but still it is not where it needs to be. It is not where it needs to be. We definitely had more mental health utilization than normal public, than general public, but it needs to be way more than that. Anxiety, if you think about anxiety, and if you think about the mental health symptoms of COVID-19, what happened, what was the trajectory? When COVID-19 started in March of 2020, the first thing was panic, phobia. Everybody was panicking, phobic. What's going to happen? Are we going to die? Even physicians who will come home would not enter home. They will take their shoes off, change their clothes, even in garage, some of them, because they were worried that they were going to give infection to somebody at home. So panic, phobia, all of that was there, anxiety was there. So if you see, the graph of anxiety is extremely high in 2020, but it drops down, and it's kind of at a very decently low level right now. So people have calmed down, people are not anxious. And the simple example is, we don't see mass here. So that's a simple example of anxiety. Anxiety is very common. And anxiety has a lot to do with media. 2020, media played a huge role in promoting anxiety. What would you see in 2020? Images from New York, mass graves, people dying, people on ventilator, people dying, people in the hospital. All of that would, of course, promote anxiety. Then comes depression. Again, depression, the first year of COVID-19, we had a massive increase in depression, massive increase. over 23% massive increase in depression. And it tripled in the first few months. Again, right now, it's definitely better than what it used to be. It is there, but it's better than 2020. Numbers are there, it's better than 2020. And these numbers, if you think about it, are there, but they are alarming, they are there, but compared to 2020, we are in a better shape than what we are. The thing with depression is that depression is something which stays a while, and if we don't do something about it, it stays a while, we have to do something about it. And a lot of times, something for our community leaders to know, that if you see somebody in your family who's withdrawn, who's not coming out of the room, who is not taking interest in day-to-day activities, who may have increased drug or alcohol use, or is using drug and alcohol which they were not using, those people need to see somebody because that's a warning sign. So be careful about those things. According to new CDC data, like I said before, youth is at definitely high risk because we need to pay attention at youth, because that's the reason we actually have a topic on youth also today. Young people, the number one thing they like to do is socialization. And again in 2020, they couldn't go to their school, they were unable to go to their prom, anything like that. And elementary school kids, that's the toughest because it's hard for them to homeschool. They need school. They definitely need school. High schoolers, college can do online, but elementary needs schooling. So that was the toughest part for them. And that is the reason what we see here is that 44% kids reported feeling sad or hopeless during the last year because they missed that socialization. Or if they had socialization, it was kind of partial socialization. Over half, or 55%, reported that they experienced emotional abuse. Now that's another thing we saw in 2020 especially. Kids were at home, parents were at home, and because kids and parents both were at home, unfortunately, child abuse increased. Child abuse or domestic abuse increased. Sadly, while child abuse or domestic abuse increased, reported cases of child abuse decreased. Why? Because usually child abuse is reported by schools. Kids are not going to school, so nobody was reporting it. And nobody's going to report from home because the aggressor is already at home, so they're not going to report it. But child abuse increased, domestic abuse increased, but the reported cases decreased. So that was a sad figure. And there was a lot of frustration at home too, because if everybody has to work from home, some homes are not big enough to handle that. So there's a lot of frustration. So that also perhaps contributed, but that was a big problem. Physical abuse also increased. And about more than a quarter reported a parent or another adult in their home losing a job, which increases the frustration also. So school connectedness provided critical protection of students during COVID-19. So the first 6 months of COVID-19, or maybe first 8 months when kids didn't go to school, were more stressful, but after that, Texas opened much earlier than others. School connectedness was a key, and that's always important for kids to go to school, especially the elementary. Now, suicide is a very important topic, and that's a serious topic for us psychiatrists. It's the second leading cause of death in people between the ages of 14 and 24. Now it's 14 to 34 actually. So many other deaths which may be suicide but never reported as suicide because the coroner doesn't declare, there's no autopsy, and they may be suicide. It is important, especially in Muslims, why, and we'll talk about it in a second, because a lot of time people will try to hide that because of cultural issues, stigma, all of those things. Second leading cause, ages from 14 to 24, maybe even 34. So the important thing about that is that since COVID, there was a huge spike in suicidal ideations. Now the data about suicide is 2 to 3 years lagging on this. So we have a data about suicidal thoughts, not completed suicide right now, but we saw that in emergency room, and I work in an ER also, so I know that data firsthand, there was a 30 to 40% increase in mental health cases in the emergency room since COVID. Easily, 30 to 40%. Everything coming to the ER was mental health. we had to staff, it was difficult to staff. So that's one. And the rate of pediatric emergency room visits for suicide has doubled pre-pandemic, which is very alarming, because again, young people, we're talking about, again, as I said, 14 to 24, 14 to 34, these are very, very alarming numbers, and we have to do something about these numbers. And these are people who are likely to experience serious suicidal ideations. Also, what we have seen in youth and kids, substance use has increased. Another problem in youth is, and we have a lecture on addiction, vaping. It used to be that kids would smoke cigarette or do marijuana. They don't do that anymore as much. They do vaping, which is a new problem in youth. This is the slide which is important, that American Muslims, and it was reported in NPR in August of last year, that American Muslims are 2 times more likely to have attempted suicide than any other group. That's the most important thing. Twice as likely. Why is that? Suicide is anyway high, but American Muslims are twice as likely to attempt suicide. Why is that? And the reason is actually bottom in the same article, which is that 8% of the Muslims report suicide as compared to Catholics, Protestants. But the reason is that 2 factors: religious discrimination and community stigma. So people don't go to see a provider. Religious discrimination, a lot of time you live in this community, you may be involved with another religion person, you may want to marry somebody else, and your family or friends may not approve it. It may result in suicidal ideation, depression, so a lot of those things. So religious discrimination and stigma are the 2 main reasons of Muslim suicidal attempts, and we need to seriously think about that. This number, twice as likely, is very serious. And lastly, long COVID. Long COVID has shown that people who have had COVID, I had COVID, I know, so people suffer from fatigue, shortness of breath, difficulty concentrating, sleep disorders, anxiety, depression, and the mental health risk can last up to a year. And these are important because once you have COVID, you feel that you're fine, everything is good, but the long-term risk, including your motor coordination, can be long-term. People don't talk about COVID orphans. Worldwide, there are about 5 million plus kids who have lost parents because of COVID. In US, there are 214,000 kids. 214,000 kids who have lost their parents because of COVID orphans. And some of them have seen losing kids in 2020 when they were losing parents, when the parents were on ventilator in the hospital. They couldn't even go for the funeral. If you recall, in 2020, restrictions were completely different. So that's very traumatic. So imagine the mental health impact on those kids. So think about that. So in summary, mental health issues post-COVID are numerous. Increased rate of anxiety, depression, increased rate of ER visits, increase in loneliness, isolation, increase in emotional and attentional behavioral problems, increased rate of child abuse, as I mentioned, substance abuse, suicide in Muslims, which is twice as likely, long COVID, and COVID orphans. So today's conference will try to address some of that. There is no way we can address all of them, of course. I will encourage you to attend the whole conference so that you guys are here and get as much. This is just a start, and hopefully we'll do more events like this so that we can address as many challenges as possible. Thank you.
That was very informative. Thank you, Dr. Shah. But one mental health professional once told me, name it to tame it. And I think that's really what this segment of the program is about, is naming the issues so that we can tame the issues. And by no means, like Dr. Shah said, we can't fix it all today. Rome was not built in a day, but at least we can address what the issues are. And so in the spirit of addressing those issues, next on the roster is Dr. Farah Abbasi.
Assalamu alaikum, everyone. It's really a privilege to have a champion like Ibn Sina coming forward and bringing the conference. When we started annual Muslim Mental Health Conference 15 years ago as a second-year resident, I still remember that I got few emails. The first one was from an imam who was very upset that how dare you put Muslim and mental in the same sentence. The second email was that thank God you're doing something about these Muslims. They need help. We are talking about wellness. So let me share with you this journey of 15 years. I call COVID-19 the age of unmasking. COVID literally went and sat in the cracks in the health system. And of course, mental health is the biggest crisis that's unfolding. So if I said that 1 in 4 in the United States accessed mental health care in the last year, let me repeat, 1 in 4, that includes you all. If I apply that 1 in 4 to this room, at this moment, there are people in this room who are not diagnosed, undertreated, or wrongly treated for mental health. Let that sink in. Mental illnesses are not the fire that you were seeing from far away. It's right here in our backyard. The research showing that this, I will go back to the research that you last mentioned, Muslim youth twice likely to have attempted. Why? Because you have a bullying rate for a Muslim kid is twice to 3 times at a higher risk of bullying in their classes. You have Islamophobia is not just a notion anymore. It's not just implicit bias. It's toxic prejudice that we are seeing being acted out every day. But that said and done, let's go inwards today. Bismillahirrahmanirrahim. I begin in the name of Allah, the most merciful and especially merciful. Let's hold on to this mercy before we start this journey of mental health. Thank you. What is the first book of mental health? First thing that we have to walk away from. First thing that you have to walk away with from this conference is mental illnesses are not a Western concoction. I truly believe as a practicing Muslim, if it is mentioned in the Quran and your holy book, then it was happening from then on. It was present in our cultures, in our society, because we all are human beings. We are all have suffered trauma, stressors, setbacks. And you have a thinking brain and a feeling heart. So it is imperative that at some point each one of us have felt depressed or anxious, right? But Quran, constantly, what is it telling the Prophet? La taqnatu, la tahzanu, la tahinu. Don't grieve, don't lose hope, don't get tired. Quran is acknowledging in every word. So when we did faith first aid trainings for imams, and we have trained up to, mashallah, more than 100 imams in first aid mental health training and grief counseling and suicide prevention. My imam told me the most beautiful prophetic thing, that after attending the training, when I went home and picked up Quran, I realized it's a message of mental and physical wellness. Every word is emphasizing that. Indeed, mankind was created anxious. And then this is when the Prophet is being told to take care of his health. But the cure is there too. Unquestionably, by the remembrance of Allah, hearts are assured. And indeed, with every hardship there is ease. So full of hope, so full of healing. Why then have the mental illnesses happen? Why? Because yes, we know that there is a biopsychosocial factors that have to be taken in consideration. I'm not saying that only praying, sometimes you need more than prayers. Prophet was very open to accessing health and care when he needed it. Taking time off to going to meditation, doing things for his wellness. So like Dr. Shah said, that we are the second growing religion, not because of the Sharia law, but Alhamdulillah, this is one religion that's based in mental competence. You might be born as a Muslim, but you are only a practicing Muslim if you are mentally competent. You understand, you know, you say, you practice. Then only you are a Muslim. But look at the Sharia law, the maqsad is Sharia. If it is preservation of faith, preservation of life, preservation of akal, and if you look at all our practices of religion, ibadas, or any ritual that you follow, maintaining this mental wellness is so important that anything that took it away from you was prohibited. Be it khimr, addictive substances, be it anger, be it extreme emotions, be it extreme pleasure, anything that takes away from your mental clarity were prohibited or discouraged. I say to you guys today, taking care of your mental health is part of your iman, part of your religious duty. And also, we have to understand that what we are seeing when we see research, we see census. There is a concept like there is Islamic culture which has been adapted to all the countries Islam went to. But we have to focus on what truly is the culture of Islam. There's a difference. 3 concepts in Islam, be it Quran, be it prayers, be it fasting, be it any other belief system. 3 major concepts. Starts with an individual's wellness. You are responsible for your mental and physical wellness. As a Muslim, it's your duty to live life to the most, reaching your goals, but living a healthy life. Because if you are not well, if an individual is not healthy, that individual cannot have healthy relationships. If individual cannot have healthy relationships, there cannot be healthy families. Healthy families contribute to healthy societies, healthy communities, and then healthy society. But it all starts with first person taking the responsibility of being well. When this wellness is extended to others, it turns into welfare. So every action that you take for yourself and then take for another person, you are doing welfare. But what's the most beautiful concept? That bring it all back to the community. And that's why we saw the numbers increase in Muslim communities, because this community was taken away from us in COVID, right? But communities, again, starts with small, ripples through global, and turns into ummah. So that's the goal we are pursuing right now, and I'm so glad that Ibn Sina and Chairman Rupani's commitment to bringing the work at a global level. So, biggest epidemic right now in the world is isolation and loneliness. To the point that UK now has a secretary that whole purpose is to combat loneliness in the society. And alhamdulillah, we were given this gift. Fast, but it's preferred to open it in the community because you are sharing, you are becoming aware, you are collaborating, you are creating. Pray. You can pray on your own, but pray in the community. So, really beautiful concepts that were given to us. But let's own our heritage and culture too. We were the first ones to start Muslim psychology. The psychology, the psychiatry that's built today was built on the work of Muslim scholars ahead of us. First mental health asylum was built in Baghdad. And you know what was beautiful about that? It wasn't built outside somewhere isolated. It was built in the center of the city. So if you are mentally competent, you have responsibilities. But if you are majnoon, then you become the responsibility of the society. So these asylums were built on the concept of wellness. These people were taken care by the community. And today, what do I see? The tragedy. Please, don't talk about mental illnesses in Islamic centers, not in front of the people. What would people say? When did we become from God-fearing to people-fearing? That is where our stigma lies, and that's where our work lies. So, Abu Zaid Ahmad Sah al-Balkhi talks about centuries ahead of his time in realizing the importance of mental and physical health. And you can see the diagnoses were given that long time ago. Depression, fear, anxiety, phobia, OCD. Even Quran talks about OCD. Kul a'udhu bi rabbin nas. Min sharril waswasi khannas allazi waswase, the obsessions. So it's amazing. We need to own our culture and heritage. So Dr. Shah has talked about this already. We have to do intra-faith work, embrace our own diversity, different cultures. We are all on a spectrum of religiosity, spirituality, and culture. So we all have very individual perspective of mental illnesses, and the treatments have to be adapted accordingly. So if you look at the 7 habits of successful men, what are those? Like gratitude, already given to us. Patience, already given to us. Philanthropy, already ingrained into our being. So it's very interesting. The research says, if you do a kind act, a lot of oxytocin, the good feel hormone releases in your body. But interestingly, if you see someone else do it, same feelings happen. If you read about it, same thing happens. That's the power of a kind act. And that's how, even the power of your smile, power of embracing the vulnerable, power of doing something beyond your comfort, that's all already given to us. We are already very successful human beings if we only know how to be a good Muslim. This is something so important to understand for this community, that when it comes to mental health struggles, they first reach out to spiritual leaders, then they go to primary care setting. We as mental health providers see the community only in times of crisis, when it's already too late. And we have to change that. We have to bring mental health from the outside to the center of our well-being. So this is a collaborative care model that we are already practicing with a lot of Islamic centers, where we refer to each other. If I have somebody who's going through a spiritual crisis, I will refer to the imam. Or if imam feels that somebody is having a breakdown, depression, anxiety, psychosis, or is at high risk of suicide, they will refer back to me. And this is a picture. So one thing I want to talk about quickly is, when we say Muslim mental health, please let me explain one important piece. We are not promoting, we are not teaching religion. What we are talking about, that when we separate state and religion, sometimes we forget that for a religion-based community, faith is a very important part of their healing. So we have to bring faith in that conversation. But it is not about a maslak, it's not about being Sunni, being Shia. As you can see, we had imams from all sects come and attend. Another important piece to remember, in order for you or you all to become an asset for someone, in order for religion to be validating, the faith leaders, the community leaders have to understand you have to be validating. You have to be inclusive. You have to embrace the downtrodden, the vulnerable, the ones that are lost, the ones that are struggling to find their path back. Mental health is not about being judgmental. It's not about sin or hell or heaven. It's about being there for your fellow human beings. Be there. Lastly, there cannot be health without mental health. Amen to that.
Mashallah, what a wonderful talk, Dr. Abbasi. I'll ask Dr. Bassem Hamid to join us on the stage. Dr. Bassem, are you here? And he will introduce the Congressman. Thank you again, Congressman, for your support of Ibn Sina and all that you've done for our community. Just get a big round of applause, please.
Assalamu alaikum and good morning. I am deeply privileged and delighted to introduce our guest of honor, Congressman Al Green, who serves and represents the 9th Texas Congressional District. And he's been serving in this position since the year 2005. Prior to that, he was elected as Justice of the Peace in 1978, and he served in that position for 26 years. So he has a huge track record of serving Texans and Houstonians. One of my favorite lines from Congressman Green is, "I'm a doctor, Congressman," so that really hits home when he says that it should be health care and not wealth care. And for Americans, actually, that diagnoses the problem of our healthcare system. And this resonated very well with Ibn Sina Foundation that really took that motto and made their operations based on that to make healthcare access to the people who need it most, and make those underprivileged people have access to the healthcare without worrying about the wealth aspect of it. Congressman has been supportive of Ibn Sina Foundation and has been attended all its operations and functions, and we thank him for that. So please help me and join me in welcoming Congressman Al Green.
Thank you very much, Dr. Hamid. Would you please join me in giving Dr. Hamid a big expression of appreciation for the very fine introduction. Thank you so much for your very fine and warm words. I also would like to recognize, if I may, the MC who has done an outstanding job, Nadine. I want to thank you so much. Would you join me in giving her an expression as well? I did not say assalamu alaikum. Assalamu alaikum, everyone. I sometimes get started and just can't stop myself, so please forgive me. But I have to acknowledge a couple of additional people, if I may. I have proclaimed him a doctor. I've said he's a doctor. And I'm talking about the Honorable Dr. Rapani. Would you give him a big hand, please? He is the chairman at Ibn Sina. Thank you, doctor. Thank you so much. I have to recognize Dr. Azam. Is she here? She's not here? Okay, well, I'm recognizing her because She helps me get my shots, okay? And she's really a wonderful lady and does an outstanding job. So give her a hand too, please. Thank you. And now, Dr. Azam, I thank you so much too. Would you give him a hand, please? Thank you so much. Thank you. Okay, friends, I'll be terse and laconic. A couple of things quickly. Yes, health care should not be wealth care in the richest country in the world. We have more resources than any country in the world, and every person in our country ought to get health care. Doesn't matter whether you're rich or poor, doesn't matter your status in life, doesn't matter where you came from. If you're sick and you need health care in the richest country in the world, you ought to get it. This is what we should be all about. And I will tell you this, I have noticed that if you are a bank robber and you rob a bank, and we should hurt you in the process, when we capture you, we will give you aid and comfort. If you're on the battlefield and we're at war against you, if we should wound you, when we capture you, we will give you aid and comfort. If we can give the bank robber and the enemy combatant health care, we can give health care to people who are working hard in this country every day. We can. Health care for all. But not only should it not be wealth care, health care ought not be sickness care. Sickness care, there's a difference. Health care involves preventive medicine. Sickness care is what our previous speaker spoke of when it's a crisis, and then we intercede. I think that in this country, people ought to have preventive care. I think that in this country, mental health care is significantly important to all aspects of your life. If you're going to have good health, you've got to get good health care when it comes to mental issues as well. So I want you to know that this conference means a lot because we're going to make sure that every person gets the kind of care that he or she deserves and not allow it to be a stigma. It is an honor to know that there are people who are willing to serve us and make sure that we are healthy. Members of Congress need a little bit of this health care too, you know. There's some of us that we probably could benefit from some mental health issues, one or two. Moving along, Keith Ellison will be here later today. Keith and I sat next to each other in Congress for a few years. He is an honorable person. I won't be here when he arrives, but would you please tell him that I stood at this podium and that when I addressed you, I did ask that you would do the following. Give him a big expression for what he has done. Keith Ellison, Attorney General. Thank you. Finally, friends, I have someone with me who is a rising star in our office. She has started out as a fellow. She's now full-time. And there's an interesting thing about people who work in our office. You can start at the bottom and you can make it to the top. My chief of staff, Niha Razi, from Pakistan, started at the bottom, but she's at the top, chief of staff. Some people believe that things like this are important, and they write letters indicating such. And when they send these letters to me, if someone should do so, I send the letter to the people who make the final decision. I don't make the final call, I make the first call. Having made the first call, it doesn't hurt to have people who believe that this is a pretty good idea to send letters. I'm not asking you to send, but if you should, I promise you it'll get to someone who'll know that there are people other than your congressperson who wants to see this happen. Having said this, I now present a certificate of special congressional recognition to the Ibn Sina Foundation in honor of your service to the community on behalf of the constituents of the 9th Congressional District of Texas, many of whom are here today, I might add. I salute you for your steadfast commitment to providing comprehensive health care by exploring access to mental health services across the greater Houston area. And when you help one person, you help every person. I do believe it. There is a domino impact associated with what we do. So I thank you for what you do, and I'm proud now to present this certificate of special congressional recognition to you. Thank you so much, everybody. Allah Hafiz. Allah Hafiz.
Let's have another round of applause for that excellent investment in mental health care. Thank you for your advocacy and for your voice. Our last few speakers before lunch, again, we'll be focusing this next segment on youth, addiction, and then we'll have an address from Attorney General Keith Ellison. Real quick, Congressman Al Green, I don't know who the MC is, but she's missed a spot. So we actually have an award for you before you step out. So I will re-invite you to the stage. I'm so sorry, I know you have some press. We'll ask Mr. Rapani and Congressman Al Green to join us on the stage for a quick award to honor you for all that you've done for the community. And I'd like to welcome the Associate Professor of Baylor College of Medicine, Dr. Sophia Banu. So please join me in a round of applause to welcome Dr. Sophia Banu.
So, like I was introduced, my name is Sophia Banu, and I'm a child and adolescent psychiatrist and adult psychiatrist at Baylor College of Medicine, and I've been practicing for the past 14 years, seeing children and adults at Baylor, and also at St. Luke's Roosevelt Hospital in New York and Bellevue Hospital in New York. And I'm really honored to be part of this amazing conference this year. I would like to start off by first defining health. Why is mental health important? As we all know, mental health disorders are increasing day by day, and mental health disorders and substance use disorders are among the leading causes of disease and disability worldwide. And depressive disorders, which used to be the fourth leading cause of global disease burden, in 2020, it became the second leading cause of global disease burden after ischemic heart disease. And why is this important to know? Because the suicide rate among the ages of 10 to 64 is now one of the leading causes of death. And it's unimaginable to think that in 2020, suicide was the second leading cause of death for ages 10 to 14 and ages 25 to 34, and the third leading cause of death for ages 15 to 19. So if that shouldn't scare us, I can't imagine what else would scare you to think about mental health and seeking treatment. The other thing that is important to know is about 20% of the world's children and adolescents have mental health issues or problems, and about half of the mental health disorders start before the age of 14. So that's why it's imperative that you pay attention to your children at home and outside. And one thing I want to mention about maternal mental health, that it's really important for us to stress that because it's treatable. You know, we have medications, we have therapy, you know, it's treatable. So if you don't treat that, then the child's growth and development may be negatively affected as well as the parent's health also. And of course, mental disorders increase the risk of somebody getting diabetes, HIV, cardiovascular disease. And on the flip side, if you have these medical illnesses, you can also get mental health disorders. You can also have, like with the genetics, if you have a high loading of major depression or anxiety disorder in a family, then the likelihood of your child or your grandchild getting depression is also very high. One thing to keep in mind with children when you see children is there's something called the adverse childhood events. If a child has been through a lot of trauma, losses, abuse, conflict at home, then the ACEs number is going to be high, and that child is more vulnerable to, you know, getting being depressed or anxious. So you have to keep that in mind. This can, if it's not treated or if it's not addressed, and it can lead to negative style for interpreting and coping with stress. And again, like I mentioned earlier, you can have other comorbid medical illnesses that can cause depression. And of course, one thing to remember is that there are medications that you can take that may also cause depression. For instance, if you're taking propranolol for high blood pressure, the side effect of that could be depression. So it's important for you to seek treatment and make sure that, you know, your doctor is aware of what medications you're taking. So talking about the US teenage mental health crisis, as per CDC, from 2009 to 2021, the persistent feeling of sadness and hopelessness rose from 26% to 44%. And they say that this is the highest level of teenage sadness ever recorded. And what is causing this teenage sadness? It's the stress about the world. and especially in America, it's the gun violence. A lot of our teenagers are worried about climate change and political violence, of course. And while I was preparing for this presentation, I have an 18-year-old at home, and I asked him, what should I add to this presentation that you as an 18-year-old, face in your day-to-day, things that are going on? And he said, Mom, make sure you add this, that the stress for teenagers is a competition of peers, FOMO. Does everybody know what FOMO is here? I want to get a show of hands. Yes, that's good. He had to teach me. It's called fear of missing out. Yeah. So not having enough and not fitting in. So that's what he said, Mom, you should add this. So I'm adding this because of him. And he also told me, he said, you should add this, that the social media makes an individual egoistic, individualistic, and it's addictive. So make sure so I'm getting his message across to you guys from an 18-year-old. Thank you. And so they found out recently, right, from 2007 to 2019, teenagers who slept more than 8 hours decreased by 30%, which is a lot. So that means they're less likely to go out with friends and play sports or spend more than 5 hours on social media. And sometimes it's social media, it's not the problem itself, it's what it replaces that's the problem. And we all know this, I think, low self-esteem, internalizing distress, girls do this more than boys, and there's social isolation because you're on the phone all the time or you're on social media all the time, but you're also at the same time seeking social approval. So when you seek social approval and you don't get it, then your body image, your self-esteem goes crashing down. Then of course there's cyberbullying. And last but not the least, Islamophobia is rampant on social media. So please be aware of your children. What platform are they using? Who are they hanging out with? And there's no single factor at play for us to blame, like, oh, it is this or it is that. That's why our children are more depressed or our children are more anxious. It's a lot of factors into play. There's an inability to handle cognitive dissonance in some of our children. Media access to sites that are constantly pointing out towards things that are depressing. You click on the news and then the news feeds itself off of depressing events. One thing leads to another. And there's a misconception that today's mental health is, going downhill because of the pandemic. That's a misconception because mental health disorders in children and adolescents was already on the rise up. But when the pandemic hit, it amplified it even more. So it's not the pandemic. Pandemic definitely has a part to play, but it made it worse. Social media, of course, uses psychological backing to keep us hooked on it. They keep us engaged. It grows day by day and constantly brings us back. So in 2019, NYU and Stanford University did a random experiment where they forced people to get off of social media for about 4 weeks before a midterm election. And the results are as you would expect. Most of the kids who got off of social media were able to spend more time with family and friends, and this was consistent with social media displacing pro-social behaviors. And overall, they spend less time watching news, and they reported a subjective well-being, feeling of well-being. And the other thing they found out was that this was consistent with concerns that social media played some role in the recent rise of polarization in the US. So if you guys haven't watched this documentary, I urge you, if you have teenagers and children at home, to watch this documentary called Social Dilemma. And I just have a few quotes from the documentary about the people who made social media, who created social media. And this is what they had to say in the documentary. If you're not paying for the product, you are the product. So remember, then your children are the product. False information spreads 6 times faster than the truth. Facebook is a tool of persuasion, and it might be the greatest ever created. It is a simultaneous utopia and dystopia, and that's why that addiction factor comes into play, right? And it's not the technology is not the threat, because I'm always looking at videos from Yakin Institute, Mifta Institute, Mishka Institute. I gain a lot. But the technology's ability to bring out the worst in society, that is the threat. So please keep that in mind as parents. So I wanted to touch very briefly on depression and anxiety before moving forward. In 2020, as per the World Health Organization, 264 million people of all ages suffered from depression. It was the second leading cause of disability worldwide, and that's why, Mr. Rupani, this is really important to have this mental health conference. Suicide is one of the top 9 leading causes of death in a large population. And the best part about this is that there is treatment available. There is pharmacological treatment and there's psychological treatment for moderate and severe depression. Anxiety, the reason why I want to stress about anxiety is because it's the most common mental health disorder in the world. So 2.7 to 7% people suffer from anxiety disorders, which means about 284 million in 2017, 63% female, 37% male, and 3% of 6-year-olds suffer from anxiety disorders, 5% of teenage boys, and 10% of teenage girls, and these are numbers from 2019. By 2022, I am sure this has more than doubled, so just for you to be aware of that. And what is anxiety, right? I'm sure we all have anxiety. I was anxious coming for this presentation, preparing for this presentation. And so because I was anxious, I took some time to, watch for YouTube videos. How could I make this more entertaining? Because it can be quite depressing and, mundane. So, that made me work a little bit more, right? So normal anxiety is good. If your child has an exam and if they have anxiety, then they're going to study for it. If they don't have anxiety, they're not going to study for it, and who knows, they may fail, unless, of course, he's a genius. But it becomes a problem when it becomes pathological, which means that it gets in the way of your functioning, it gets in the way of you enjoying things, it gets in the way of how you interact with your spouses, with your children, with your bosses, with your colleagues. Too much anxiety can have an effect on learning and social development, so make sure you keep an eye out with your children. The other symptoms are you may have difficulty falling asleep. A lot of patients with anxiety tell us that they can't shut off the brain because at night they're lying in bed and then they just keep thinking, what did I say? What did I do? What did I wear? What am I going to do tomorrow? Some of these are normal anxiety, but it just doesn't switch off and it goes on and on and on and on, and then you look up and it's 3 o'clock in the morning, and so now your day is going to be really bad, and then that makes the anxiety even worse. Muscle tension, there's a lot of stiffness around your neck, back pain. If a patient comes to us and complains of neck pain and back pain and there's nothing wrong, we usually say maybe you have anxiety because they're constantly on edge all the time. And it's difficult to control the worry. I just have this slide up because I want the audience to look at how a panic attack, how it works. So you can have feelings of dizziness, unsteady, you have shortness of breath, and then chest pain, and also you can have nausea and abdominal stress. And the other thing that patients tell us when they have a panic attack is they feel like the walls are closing in on them. You're in a big, huge room, but you feel like you're in a small room. The walls are closing on you, and there's this sense of impending doom. And you feel like, some people tell us that you feel like I'm about to die. Like, literally, some people think they're having a heart attack. And it could be a heart attack, so make sure that you get treatment, make sure that the cardiac causes are ruled out. And panic attacks can happen anywhere, and it's happening very commonly in adolescents and children now because of the pandemic, because of other issues, gun violence in schools. So please recognize that when it's a panic attack, sometimes you don't need a trigger. It could happen anytime, anywhere. So these are some of the symptoms to look out for. I've just been told I have only 10 minutes, so I'm going to rush through. I really want to, on this slide, the silent sufferers. So we have children, adolescent youth, who get angry and agitated, and they have temper tantrums, and they're throwing things, and you feel like, oh yeah, I need to make sure he sees a therapist. But you have some kids who are very quiet. So I want you to pay attention to the quiet kids because they are called the silent sufferers, and they may not tell you much. Just because they're sitting quietly at the dinner table and not saying much doesn't mean that they're not suffering. They may be suffering from inside and they just internalize it, and it becomes worse and worse and worse. And by the time you realize there's something going on, it might be a little bit too late. So make sure you keep your eyes and ears open for children who are quiet also, not just the ones who have externalizing behavior. They may have a thyroid problem that hasn't been addressed. They may have anemia, if you have a teenage girl and if their periods are really heavy and you just say, oh yeah, your periods are heavy, but you don't really address it. If they have anemia, that could cause depression and anxiety. And so even if they come to us and we treat them for depression, if we don't correct the blood loss with iron or other, treatment, their depression is not going to get better. Vitamin D deficiency, of course, autoimmune disorders will also cause depression, will have depressive symptoms. So make sure that when you take your child that they do a whole checkup to rule out. So as a parent, what can you do? You make sure that you intervene at the appropriate time rather than escalating the situation. Be a parent first. Make sure that your child is safe. Make sure that you know who your child is hanging out with. Make sure that you're aware of what kind of platforms you're using. And I know there's this privacy issue. You have to honor their privacy. But at the same time, if you think there's something going on, that should go out the window because you're more concerned about your child's safety. Be a friend, of course, if you can. Very briefly, I want to touch on this. Some of the things that you can do for your children is to practice self-compassion. And I found out about self-compassion about 2 years ago. I watched Smile to Jannah. Does anybody watch Smile to Jannah, a UK program? It's a satirical program about day-to-day happenings. No? But please watch it with your kids. My kids love it. It's a very funny, way of handling or addressing issues that are going out in the world. So it's about how you want to be kind to yourself. Like, when somebody's hurting or somebody makes a mistake, what would you say? You'd be like, oh, that's okay, no worries. Maybe next time it's going to be okay. But if you make a mistake, what would you say? Oh my God, yes, exactly. Oh my God, I'm so stupid. Oh, I'm always doing this. I'm making this mistake. Why don't I learn? You're hard on yourself. But self-compassion is about teaching you to be compassionate to yourself, accept your mistakes, accept that you're human, and allow yourself to care for yourself. And I found it very interesting that this is in the Quran also. I watched a YouTube video by Miss Samia Mubarak. I want you to check that out. She talks about surahs in the Quran that talks about self-compassion. It's amazing. It's really, really beautiful. I want you to watch that. And so these are some of the things that, you're not ignoring your pain or you're not, criticizing yourself. You're just being kind to yourself. And one of the exercises that she does, Dr. Kristen Neff does, is about supportive touch. And it says that there's a lot of research that supportive touch, like if you touch your hands like this, the skin is an incredibly sensitive organ, so it releases the oxytocin, and that helps you to calm down, it soothes your nerves. And like how a mother, when a baby is being held by the mother, how the baby calms down. So the same way if you, consciously do that, it helps you to calm down because the parasympathetic nervous system is activated. And I thought, when we are doing our salah, and self-compassion also about mindfulness, you're being mindful, right? You're praying, you're in front of Alamia, and you do this, right? Like when you're praying, or men do that. And I thought, we're already practicing self-compassion 5 times a day when you're doing this. So just be conscious of it. You're in a lot of distress, you're asking Allah for forgiveness, and you forgive yourself also. And you do this touching, the supportive touch, it releases oxytocin and it helps you to calm down. So I thought this is amazing that these things were already in the Quran hundreds of years ago, and here we are talking about it now. And also I wanted to just, I know there's some who are very scared to go to see a psychiatrist. I just wanted you to know, when I see a child in the clinic, in the child clinic, we do an evaluation. We talk to the parent, we talk to the child, we contact the school, we try to get everybody involved. Just because you see a psychiatrist doesn't mean I'm going to be prescribing 10 medications and here you go, It doesn't happen like that. We order labs, we make sure that we address the whole body as opposed to just, oh, he's being a bad boy or she's being naughty, So we address everything. So we provide psychoeducation, and medication's always never the first step. We provide psychoeducation, we do supportive management, family involvement, school involvement. School involvement would look like if you're a really depressed child, you can have wraparound services in school, counseling services. So therapy is really, really important because your child will learn coping skills that will, improve your self-confidence, improve your self-esteem, and these are lifelong skills. These skills that your child will learn from a therapist, they can take it from as they grow from station to station, and it will never hurt them. It will only help them. So please consider therapy if your child needs it. Support, self-care also is in the Quran. Praying, reading the Quran, allowing yourself to cry is fine too. Get support, like I said earlier. Islam is a religion of self-care. It does not require us to be superhuman. All children are resilient. Resiliency is there in everybody. So as long as the child is supported, as long as the child is able to express their fears openly, they will cope with the anxiety. They will be able to shed the anxiety and find good ways to cope with it. Studies have shown that children and family who use community resources like Ibn Sina, Yaqeen Institute is another one that I'm a big fan of. There are many, many articles on depression, anxiety, procrastination. So all of these are available online for you guys to reach out and help your kids. Ibn Taymiyyah said, I have not seen anything that nourishes the mind and soul, preserves the body, and secures happiness more than continuous reading and contemplation of the Book of Allah. I know we don't have any time for questions, but if you want to talk to me, I'm in that table. Thank you so much. Assalamu alaikum.
That was amazing. Thank you so much, Dr. Banu. I'm known for, I appreciate you saying that it's healthy for us to cry. I'm known for being a crier. I was really touched by the idea that Salah is like a little hug. So can we just take a minute and everyone just give yourself a little hug? And let's feel that oxytocin. Anyone else feel it? I feel it. I like that. So thank you, Dr. Banu. I really appreciate it. Wonderful. I am learning so much. So we are on the final stretch, my friends, 1 hour until lunch. So we have just a few more speakers to wrap us up before we break for lunch. Next on our list is Associate Professor of Psychiatry and Behavioral Sciences at Baylor College of Medicine, Dr. Nidal Muqaddam, to present on the topic of addiction. So apparently addiction is considered one of the diseases of despair, or substance abuse and suicide are part of the diseases of despair. We've talked a lot about suicide and some of those challenges, so addiction often is one of those precursors that creates that issue. So Dr. Nidal, please join us, inshallah.
Hi, thank you. Welcome, everyone. I think I'm the one person holding you from lunch, right? So we'll try to make this effective. Do we have my slides up? No slides? Slides. So today we're going to talk about a very important topic, addiction. And I'm going to try in the 30 minutes that I have to cover basic stuff like tobacco and things that we're not supposed to even have in our lives, like alcohol and drugs. And we're going to touch a bit on gambling and internet addiction. And so, as our kind presenter said, I work at Baylor with Dr. Shah. I have a psychiatry training and I do quite a bit of research. And in the US, unfortunately, there are millions of people who struggle with addiction. So millions of people struggle with some sort of alcohol use disorder, some sort of drug use disorder. And it is a very significant problem because when you look at the statistics, it starts young. So if you look at people age 12 and above, they have started in high school. And so if you look at these numbers here, you'll see we're talking tens of millions of people. And the highest rates are, not surprisingly, in our youngsters. So 18 to 25 would be young. Now, closer to your mouth. Thank you. So when somebody is using and they're young, you might be tempted to say, oh, they're just going through a wild phase. Oh, it's just, just a phase. Or they're just in college. They just broke up with somebody. But it's not really like that because that addiction can then become a problem. And so 47% of young people have used some sort of drug before they graduated high school. So let me ask the room here, is that a yes? Do you know young people who've used, say, marijuana? Yes, I see hands. Very common, and 70% of people who will turn into illicit drug use would have tried something when they're younger. So if you try it young, you're more likely to get hooked on something bad. Okay, so I like this statistic. 70% of users who try an illegal drug before age 13 will get hooked. So really you want to make sure you are protecting your young kids very carefully. Now, why are we doing this? We are doing this, of course, because addiction is a bad disease that has multiple bad effects. I will take the example of alcohol here. You can drink alcohol in zero way, so I could be an abstinent person. I could drink alcohol socially. I could drink alcohol on weekends like college kids do. They pretend they don't, but they do. So Friday, Saturday, Sunday, you see them Sunday and they're completely smashed. And then the rest of the week, they pretend that they're okay. And you can be the daily drinker. So if I say alcoholism, people think, oh, maybe the bad daily drinking. But it's not always like that. Sometimes it's, I just drink until I lose control, sometimes. And of course, this differs for men and women. And so low risk, we think, is just a drink here and there. Moderate risk will be that binge drinking where somebody can sit down and take 4 or 5 drinks of alcohol. So then you're going to say, but Dr. Mukadam, we don't deal with this. Our religion says no drinking. And here's the problem. What religion says is not always followed. So from this slide, what you want to take home is that only 2 to 3% of people drink heavily. But there's a whole bunch that drink enough to cause themselves problem. Drinking varies between men and women. And what we're going to talk about here is going to be very similar for all sorts of drugs, whether it's drinking or tobacco or anything. Here's how we diagnose it. So let's say you go to a psychiatrist or your regular doctor or just talk to somebody. Like say, hey, my son has a problem, my daughter has a problem, you know, my kid's spouse has a problem. What is it that they're trying to do? They are trying to figure out if that person deserves a diagnosis or if it's just social use, okay? And I don't want you to be stuck at alcohol. I want you to think tobacco. I want you to think internet. I want you to think gaming. How many of you have kids who game too much? Yes, I see hands. Yes. Same principles. So we start with the orange part, misuse. Misuse is mild. Okay, you're doing this a little too much. It's causing some problems, but it's still okay. So we diagnose misuse, but we often don't do a whole lot about it except saying, hey, do you see what you're doing? And then you go to the moderate stage, which a lot of people call abuse. Abuse is when it's actually causing you trouble. Somebody is smoking too much and it's causing them financial problems because, you know, tobacco is expensive. That's a problem. Somebody is doing their gaming too much to the point that they're missing out on occasions or they're cranky when you take their video away. That's an addiction, believe it or not. Same apply for drugs. And then dependence is your more severe form where you're really hooked on it. And I'm going to explain what that means exactly in a minute. So basically, substance use or addiction is one disorder, and you grade it as mild, moderate, severe. And we like to think that all addictions are the same. So you're going to hear terms like behavioral addiction. Behavioral addiction, like gambling and internet, are the same as substance addictions. Okay. So, here are the classes of drugs we deal with the most. Alcohol is so prevalent in the US society. When you are trying to raise a family here, when you immigrate, you come from an environment that maybe does not have as much alcohol, you come here. Have you noticed that people drink here when they're sad, when they're happy, when they're lonely, and when they're with people? Right? I mean, it's not like one setting only. You don't just drink in one setting, you drink in all settings. And then you're like, okay, no, we don't drink alcohol. Fine, that's great. My kids have been lucky, they don't drink. Have they been exposed to marijuana? Can any of you say your kids are not exposed to marijuana? They are. It's everywhere. Okay. And then, okay, luckily they haven't done marijuana because, you know, they've been cautious. How about cigarettes? And so the problem is there is so much temptation around us, and it's sometimes hard. So therefore, it's best to keep it under same principles. So here are the classes: alcohol. I put caffeine on there just because there's research on it, but I know we all drink caffeine, so we're gonna skip. Inhalants. Inhalants are a problem because this is the stuff like your whipping cream, like your hairspray, and so some kids will get addicted to that, and it can cause brain damage. And then we also deal with marijuana, of course. And then the bottom are substances that bring more problems. So of course, if your kid or somebody you love is dealing with this, you want to be very careful. Hallucinogens are things that cause hallucinations, so they cause you to see or hear things. Opioids, as you know, are painkillers, and I'm sure all of you have heard of heroin, but believe it or not, most of us in Texas don't get the heroin stuff. We get the painkiller, we get the, oh, I had dental surgery, they gave me 10 pills, and then, oops, my 10 pills are gone. Who took them? Maybe it's one of the grandkids, right? I see people nodding. So it's easy to get addicted to stuff around the house, and that's why you want to be mindful of that. Sedatives, hypnotics, and anxiolytics are basically sleep aids. I'm originally from Lebanon, and I'll tell you that we probably have a 30% rate of addiction to those substances, to those medications, and they all come legally from doctors because we've been through a civil war. We all have some sort of sleep problem. I mean, that's just the way it is. And so sometimes we're not using that because we're bad people. We're using it because we've gone through stuff. It's some sort of problem that we have not dealt with because there's a lot of stigma. That is called the self-medication hypothesis, by the way. And then stimulants. Oh my gosh, there are so many stimulants around us in the South. They're so cheap. Stimulants will be things like meth and cocaine, so basically stuff that gives you energy and makes you not eat. You go try a weight loss clinic, they might give you something that's a little bit stimulanty, you're happy with it, and then one of the grandkids takes it from your medicine cabinet. Be careful, very possible. So these are the classes of drugs. Some new things come on the market here and there, but these are really your main classes. And when you are looking for signs, you're like, okay, well, what am I looking for? Because everybody uses a pill from time to time. You are looking for changes in routine. If my kid has straight A's and suddenly does not have straight A's, that's weird. If my kid used to sleep 8 hours a night and now stays up until 3, that is different. That's a change. So we're looking for changes. My kid usually eats 2 meals a day. Suddenly they're really hungry at 4 in the morning. I come down to the kitchen in the morning and, oh wow, the fridge is half empty. Yeah, I see people laughing here, right? If you know anybody who's used marijuana, that's exactly what happens. They raid your fridge after they've smoked, right? So you're basically looking for changes in routine, and your routine is personal, so my routine, your routine will not be the same. Therefore, when we do an assessment, it's really important to look at what were you like before and what has changed. Changes in physical appearance. So I have a lot of friends who tell me, my kid has lost 20, 30 pounds because they're vaping. They're not vaping marijuana, they're just vaping nicotine. But you know nicotine is an appetite suppressant, and 16 years old gets her hand on a nicotine vape, loses 20 pounds, aren't you going to be worried, right? You're going to think they have cancer. And as Dr. Bano pointed out, we have to make sure there's not a medical illness. But ultimately, it turns out to be vaping. I can't tell you the number of people who come to us and say, my kid lost 20 pounds. My kid has not been sleeping. Sometimes you see issues with finances, so where is that money going? There's money that's being spent, where is it going? Why did the Xbox disappear? Stuff like that, because sometimes people will do all sorts of things to finance the habit, and then excuses and missing obligations. First time you tell me you have a headache, I'm going to be concerned about you. Second time, I might ask you what's going on, but at some point I'm going to wonder, you're missing a lot of things, are you okay? And it could be that you're spending time recovering from whatever it is that you've used. So here's what we look for. We use a book called the DSM-5. This is the main book we use to diagnose in the United States. And I've divided the criteria into two sets. I've divided the criteria into the set that kind of makes sense. I'm just going to read them to you, and it's going to click, and then some that I need to discuss a little more. So we're going to start from the very top. The hallmark of an addiction is taking the substance or doing the behavior more than you intended to. So I'm going to take the example of smoking. I'll tell you I will smoke half a pack a day, and I end up smoking how much? 2 packs? A whole pack, right? How much is a pack of cigarettes? $8. That's a lot of money. Thank you. Yeah, that's a lot of money. I'm not gonna ask how much an ounce of marijuana is. Don't want to embarrass anybody. But you know how expensive that stuff is. Gaming. You think they tell you we're gonna play a game for 30, 40 minutes. You call them for dinner. They don't show up for dinner. That is right there, the first sign of being hooked. They cannot control their use, right? And so that's the one on the very top. Oops, sorry. I need to be careful with that. Second, wanting to cut down or stop, but can't. Like, oh, I promise you I'm not going to play that video game. I promise you I'm not going to smoke. I promise you I'm not going to do that. They do it a couple of days, they're good, and then poof, it starts all over again. So often when you come to treatment, when you come for an assessment, the story we hear from families, oh, this started a couple of years ago. They stopped, but then they started again. It's the same story. Because you don't get treatment right off the bat. First, as a family, you're going to try to solve it, and then it kind of gets worse. And then spending time getting what you're doing, the substance, or the video game, or the internet, recovering from its use is a big one. So for alcohol, that'll be like somebody gets drunk, the second day they're hungover, there you go, they just missed another day of their life. For gaming, it'll be like I missed a social event, and then I had a fight with my family because I missed it, and then look, next day is gone. Wasted the weekend. For cigarettes, it'll be I smoked too much, I ended up with shortness of breath or chest pain, had an argument with my spouse because, you know, they told me that it's gonna make me worse. They told me allergies are high. They told me asthma will be bad, right? There's all the stuff, and then makes you waste another day of your life. And so that spending recovering cycle is also a big time suck. And then, that means that you're not managing what you need to do in general, work, home, school. But that's very hard for people to admit. And, okay, no offense to the men around here, but I think that's harder for the men to admit sometimes. They get angry when you say that. But that's our central one, central bubble right here. And then you might end up giving up some important stuff. Like I ask people, and they're like, oh, you know, I love to play basketball, haven't done it in a while. I love to do this, haven't done it in a while. And this is when a concerned family member would say, Dr. M, do you think they're depressed? Maybe they're depressed. I didn't say they're not depressed, but maybe they're also still struggling with the substance or the habit. So basically, it's all about the habit. And then you use, even if it causes you problems, and then people will have cravings, like, oh, I can't wait to get home in order to be able to play my video game. I can't wait to get home until I get that drink, etc. All the principles are the same. So basically, this is some of what you're looking for. And then, does anybody know what these mushrooms are? These are hallucinogenic mushrooms. These are the type of things people will pick from the woods, they eat, and then they hear stuff. It's really interesting. But so basically, what you're looking for when you're assessing are certain medical things that are gonna make it hard for the person to quit. So we're looking for a concept called tolerance. Tolerance is, I am using more and more to get the effect I need. When you start smoking, first time you smoke maybe half a cigarette, maybe you get nauseous. By the time you're used to a pack a day, a cigarette barely does anything to you, right? So that is called tolerance. Same thing, I take a medication for pain after surgery. First time, it knocks me out. I fall asleep. In about a week, I'm okay. That's called tolerance. Physical dependence is the other one, that you get hooked on it physically, your body wants it. Your mind says, not a good thing, but your body really wants it. And so you can see it very easily with all the substances that we use, especially caffeine. So we're not gonna diagnose caffeine addiction right now, but I am gonna tell you that if you skip caffeine on weekends, don't you get a headache? That's called withdrawal. So basically, I'm physically dependent on caffeine, and if I don't get caffeine every day, I will have withdrawal symptoms. Why is this on a different slide? Simply to tell you that some of those physical dependence and withdrawal symptoms are medical emergencies. So if somebody drinks, they could have a seizure. They could end up in the hospital because of this. If they are withdrawing from heroin or painkillers, it's not going to kill them, but it would be extremely uncomfortable, and it is best if we do it in a medical setting. And so these are the concepts that we look for besides these. These are behavioral signs to look for, and these are more of the medical stuff we'd like to assess for. Okay? Okay. So is addiction a sin or a disease? Show of hands. How many of you actually think there's a component of sin in addiction? I have 1, 2, okay. So about 30%. Okay. Well, I mean, it's never 100%, right? It's always black and white. So through the years, there have been multiple models for addiction. And the multiple models that have been brought forth to explain addiction, we're not talking about religion right now, just scientific models, have gone through ups and downs. So 1,000 years ago, if you got addicted to something, you could only go a certain way because you couldn't have stuff in the fridge. There was no fridge. There was no power. And so if you used too much, you could die, simply. So addiction was controlled by the fact that we didn't have all this technology and this comfort we have right now. And right now, we have all the stuff that sustains us. We can actually get addicted. And so the first model is called the moral model. Moral model says, if you are addicted to something, whether it's gaming or internet or alcohol or whatever, you don't have willpower. There's something wrong with you. There's something missing. And that willpower aspect is called the moral model. But that doesn't work very well because when we talk to people about lacking willpower, they feel guilty, they lash out at us, and then the conversation doesn't go very well. There's the disease model, and it says, you are not lacking willpower, you have an illness. You are using nicotine because you have an illness. You are using video games because you have an illness. Show of hands, how many of you agree with that? Not many, okay, 10%. So that model didn't fly well either because you have to remember addiction is a disease that hits the whole family. So if you fight with me and snap at me while you're drunk or high and then you steal my car, I mean, I don't care if it's a disease. You just stole my car, right? And so that makes the disease model not very acceptable. There's the environmental model that, oh, this is because we live in a society with a lot of media exposure, bad morals, upbringing, maybe you've had a history of trauma, etc. That is a very important model, but it doesn't explain 100%. And lastly, we have the brain model. Brain model basically says you're using because your brain is messed up. Thank you very much. So brain model is what the US governmental agencies cannot talk about right now. It's called the BDMA, Brain Disease Model of Addiction. It is very neutral. Nothing about willpower, nothing about, faith, anything else. It's all about you crave, you use, how do we break that habit? Some people find it too dry. So as I'm saying this, I'm just presenting these models and telling you none of them is 100% fit. Because addiction is a whole person disease. They're not 100% fit because addiction comes from different aspects. It comes from your biological aspect. Does it run in your family? Do you inherit certain things? Do you inherit that temperament? You know how some people just like excitement? Some people don't like boredom. They really like to have this thrill all the time. That thrill-seeking aspect, that's a risk factor to get addicted to whatever, anything. And that's a thrill-seeking aspect is your personality, and it's a very genetic thing. And then there's a family history. Maybe you do have a family history of addiction, but nobody likes to talk about it. Because, oh, we didn't diagnose it back then, or back home, we don't talk about that, etc. Then there are your childhood and social aspects. Here, very important to focus about trauma. Have you been a victim of trauma? Have you been through a war? Have you been molested or assaulted, etc.? Are you anxious? Do you have a mental illness that's untreated? Are you stressed right now? Maybe you've been without cigarettes for a while, but you're stressed this month, and so you went back to smoking. And then the environment, how much availability, how much exposure. So with that, we're gonna remember that substance use is gonna cause multiple things because it's a whole person disease. It could cause the guilt and the depression that we pick up on so clearly. It could cause a lot of effects on the family and the environment. It could make somebody lose their job or drop out of school or college. And it could even cause physical illness. I can't tell you the number of people who will have worsening asthma, worsening COPD, worsening heart disease because of that. So that is a huge deal. So what do we do about it? First, we talk, what is it, your personality, or is it your responsibility, or is it a disease? And that determines where you go from there. That's a huge one. If it's a disease, you need to treat me. If it's my personal responsibility, take my keys, take my allowance, I should be punished for it. So you see, the approach depends on what you see it as. Would you be surprised if I said that this has been in our religion for a long time? That this balance has been in our religion for a long time? It's been there, that balance, that there are things you should not do. So, just disclaimer, I'm not the most religious, but I had to talk to one of my uncles about this. And he introduced me to the word khaba'ith. He said, muharramat are things that are haram, do not do, period. But khaba'ith are things like evil, but lesser evils, you know? Gaming is not haram, but gaming could be something that's bad for you. So there are levels of evil, kind of. And so that still doesn't tell me, am I an addict because I'm ill, or am I an addict because it's a disease and I have no personal responsibility? So I'm not going to give you answers today. I'm just going to get you to think about it. Is faith enough? Again, depends on how you see it. The answer from science, not religion, is you have two models and two models only. Either you stop what you're doing or you decrease the effect. That's all science tells you. Science says if you say no alcohol, no tobacco, no this, no that, that's called abstinence. And if you say use, but don't use too much until it causes you problems, that's called harm reduction. You could also use something less harmful. For example, instead of smoking cigarettes, which are going to give you a heart attack, use a nicotine gum. So, is faith enough here? Is faith going to be enough to get me to abstinence or harm reduction? That's the question. So, here's one verse from the Quran, which, as all of you know, will say, لا تقربوا الصلاة وأنتم سكارى. Do not come close to prayer while you are intoxicated. So is this abstinence or harm reduction? No, really. Abstinence is do not use at all. Harm reduction is do not use if it's going to affect you. Is this abstinence or harm reduction? Harm reduction. Okay, awesome. And so when I'm trying to treat someone, I'm going to have to match which phase they are in order to be able to tell them harm reduction or abstinence. Because if I just pick up a solution, it might not match where they are. So these are the... I'm sorry, where did my curve go? Yeah, thank you. So initially, when somebody's using, they're not going to want to listen to you because they're in that yellow phase where they're like, oh, I'm fine. I'm okay. And then they become at this crucial phase where you're starting to see problems, but it's not big enough for you to talk about yet. It's not bad enough that you're going to argue with them about it. Then it gets to this chronic phase where you're like, hey, you've been doing this for 6 months. This is causing us trouble at home. What are you thinking? And then if the family and the person do something about it, you go up. Like we stopped that decrease and that kind of downfall. Hopefully you go to rehabilitation and recovery. So I would say that our religion is very wise in the sense that it does give you both a harm reduction and an abstinence model. Religion says there are things that are not okay, haram, do not do this. But it also says, if you slip, if you do something evil and you are doing it, make sure you don't do it close to certain obligations. Does that make sense? I think that's actually a beautiful aspect about religion. And I'm gonna say for those of you who've heard about AA meetings and 12-step models, that there's a lot of similarities here because the 12-step models are about finding a power higher than yourself, admitting that you're powerless, so basically bring faith back, make a decision that you're gonna stop this. And so there's a lot of faith-based steps here that are very similar to the model we already live by. And so there are multiple aspects here. Like I said, the models I've introduced are never 100%, but religion provides a nice framework if you were going to tie this back to religion. But what happens when faith doesn't work enough and your 12-step models don't work enough and counseling doesn't work enough? Is it okay to take medications? Show of hands. Does religion say it's okay to take medication? Yes. Okay. And so we call that medication-assisted treatment. And medication-assisted treatment is so interesting because it's basically take what you're doing, which is harmful, let me give you something safe instead. Nicotine is the best example. Nicotine gum is so easy, right? Nicotine is an example of, I can't stop smoking very well. Smoking is causing me trouble. Smoking makes my kids' asthma worse. It makes my heart disease worse. I could take a nicotine gum. When we get to worse, more dangerous substances, heroin, painkillers, etc., we call that MAT, and we give medications in the same family of drugs. Some people will say you're not really sober if you're on MAT, but as a matter of fact, sometimes it's hard to be sober. And so we want to be as kind as possible. And we want to make our decisions based on a customized assessment that basically says the person, maybe they don't have what it takes to be 100% abstinent. And I'm going to tell you, this is again reflected in the Quran, where it does say that you have to do this risk-benefit analysis. Our religion has already predicted that not all of us can adhere to the right way. And it does say you have to do this risk-benefit on a customized basis. So يَسْأَلُونَكَ عَنِ الْخَمْرِ وَالْمَيْسَرِ قُلْ فِيهِمَا إِثْمٌ كَبِيرٌ. Right? It is a sin. If you ask me, it is a sin. But إِثْمُهُمَا أَكْبَرُ مِنْ نَفْعُهُمَا. Their sin is higher than their return. So this is basically the Quran telling us about immediate gratification versus delayed gratification. You're going to use this, you're going to enjoy it right now, you're going to pay for it later. So while the religion promotes abstinence, the religion has also left a door for a very nice customized assessment and harm reduction. Medications fit nicely into that. And so I think this is nice in the path of development of personal responsibility. Stopping addiction is not going to be an on-off thing. It's not a yes-no switch. Usually it's a path and a process. If there's mental illness, we have to treat it. If there's depression, we have to treat it. And then the addiction process is never alone. It's never in a vacuum. And so my last slide is going to be pictures of drugs, just for your enjoyment. And I think I have like a minute for questions. So obviously cigarettes, drinking, inhalers, acetone, and other things. These are present around the house. Kids can just open them and sniff the gas inside of them. Extremely dangerous. A collage of ecstasy pills. Do you know what's an ecstasy pills? Meth, thank you. It used to be MDMA, but actual pure MDMA is so hard to find. It's now almost all meth. The reason Dr. Banu, Dr. Shah, and I have a very busy job is because of the meth. So, and then powdered cocaine and powdered heroin. And with that, we have a minute for questions. Thank you. you think we're going to have any questions? No,
We'll probably
probably
take
not.
them later. Yes.
Okay,
Thank
thank
you
you.
so much. Wonderful. Another round of applause, please, for Dr. Muqaddam. I learned so much. It's really interesting to see there's many different ways to combat addiction, and there's also many things we can get addicted to. So it's nice that we can redefine what addiction looks like and really stay aware as parents and as community members. Now, last but not least, before we head to lunch, I would like to invite Mustafa Tamiz to the stage. I believe he just walked in, to introduce Attorney General Keith Ellison. Thank you so much.
Assalamu alaikum. Oh, look, assalamu alaikum. It's so good to see so many of us in the room together talking about this topic. And my job is very, very simple. I'm here to bring up Congressman Keith Ellison, now Attorney General Keith Ellison. I'm still used to saying that. And then we're going to have a short conversation about mental health with him. I don't think he needs an introduction in this room, but I want to remind all of us, he was the first person to get elected to the United States Congress. And when he took the oath of office on Quran, it meant the whole world to all of us. And since then, the tragedy of George Floyd, George Floyd grew up in Houston, went to Minnesota, where he tragically was murdered in Ilhan Omar's district. And the person that prosecuted the officers that caused the death of George Floyd was Keith Ellison. So the connection, although tragic, between Houston and Minnesota is very strong. And Keith and I have traveled around the country over the years, and we've been in small towns, in big cities with the Muslim community. There's very few people, I will tell you, in the community that have visited so many Muslim communities across the United States over the years. I would say, Keith is probably the one that has done the most. And so when it comes to the issue of mental health in our community, there's very few people that understand its gravity, its importance, and how it is a critical thing that we have to address. And so you're going to hear some of that from our friend Keith Ellison, who please join us on stage. Give him a warm round of applause.
Assalamu alaikum wa rahmatullahi wa barakatuh, friends. How's everybody today? I'm often asked, why would I ever leave the United States Congress and run for Attorney General? And the answer is quite simply to get closer and more personal in trying to solve the problems that the people are facing every day. As Attorney General, I deal with critical issues affecting the health and the welfare, not only of Minnesotans, but for everybody around the country, because as Attorneys General, we work together quite a lot to try to solve problems together for all Americans. And I can assure you, particularly during this moment when we are, inshallah, beginning to be at the end of the epidemic, the crisis of COVID, but certainly throughout, the mental health needs of the people have been extremely acute. They've been tough for everyone, whether you are Muslim, Christian, Hindu, Jew, no faith at all. Everybody has faced this crisis and the psychosocial impact of COVID. And of course, we had something of a mental health crisis going on before that. When I talk to the sheriffs in the counties, they tell me that so many of the people who are in the jails are people suffering from a mental health crisis. When I talk to the police around the state, they say we get calls, people suffering from addiction, we need to be equipped with Narcan, we need to be able to respond to these mental health needs. And if we talk to the teachers in the schools, they will tell you that the students are dealing with depression, anxiety, and sometimes contemplate taking their own lives or just escaping reality through drugs. So whether it's the sheriffs, whether it's the police, or whether it's the teachers, we know that the mental health professionals are dealing with this problem. They're the ones who deal with the medical effects of it. And I'm so glad that they are here being part of this effort today. But then, of course, so often this mental health issue is a spiritual challenge as well. And the imams and the people who work and tend to the spiritual needs of our community must be a part of this conversation. We cannot defeat this problem without them. And so we know this is a societal problem, but here's the news. It is and was a Muslim problem too. Only because of shame and stigma, we have not confronted the problem as forthrightly as we might. When we're counseled, take it to prayer, good advice. But if you are dealing with a serious acute mental health challenge, you may need more than that. You may need some assistance, you may need some intervention, you might need a medical intervention. And we cannot have so much fear, so much anxiety, so much shame that we're not willing to confront this problem. If we can face it, we can fix it. If we can face it, we can fix it. And let me wrap up by just talking about the unique needs of the Muslim community, if I may. How many Muslims do you know come to the United States because of war? Anybody you know? How many come because of being in refugee status? How many come leaving a country where it simply was not possible for them to safely stay in that country? And with those kind of pressures comes things that people just don't want to talk about, like sexual assault, because that goes right along with war. People think war is men die in war, women and children suffer in war too. Sometimes in unspeakable ways. And so it does us no good to not confront this problem. And it does us a lot of good to use medical knowledge and understanding to get to the root of this so that we can improve the health and the life and the wellness of the people. So I want to thank the Ropani Foundation. I want to thank you, Doctor. I want to thank all of you who are here making this important day happen. When my friend Mustafa Tamiz told me we need you to come down and appear at a Muslim mental health convention, I said, I will be there in an instant. I've spent the last 4 years, spent the last 4 years holding big companies accountable for being what I believe is irresponsible in the sale of their opioid products. I've spent the last 4 years working on helping local government deal with the challenges of mental health crisis and dealing with the challenges of the COVID crisis. And it is absolutely time for us all to get together and focus on solving this problem and taking it head on. Because I believe, inshallah, if we can face it, we can fix it. With that, I think it's time for us to talk together. What do you think? A little dialogue? Yeah.
I'll invite you both to take a seat, you and Mr. Tamiz, to have a short discussion for about 15 minutes just on this very important topic, and then we'll break for lunch. So take it away, gentlemen.
Usually when people say, you're here, your talk is in between lunch, we try to keep it short.
Oh, yeah.
So you started the conversation about the role of imams and clergy in mental health. And I think what you're saying is critically important in this room. So tell us a little bit more about why you think that's important.
Well, so often when a member of a Muslim congregation has a problem, could be financial problem, any kind of problem, one of the first people they're going to go talk to is the imam. And how many imams have ever been, after prayer on a Friday or any day during the week, some brother or sister walks up to you and says, I got to talk to you. I got to talk to you. No, not with everybody else around. I got to talk to you. I have to talk to you. And at that moment, that imam knows that this is going to be a private conversation, it's going to be heavy. And a lot of us, when we think of the leaders in our congregations, we see them doing the khutbah, we see them doing the public things. But so many of the things that they do are private, that are one-on-one, right? And what that person hears when they meet with the imam will make all the difference as to whether they can get healing or not. And I want to commend our imams who say, you know what? I'm here to meet your spiritual needs, but you may have a medical challenge, and we're going to try to help you connect with the help you need. Those imams who do that are doing a great service to their members of their congregation. And then there might be some who think, this is you just don't worry about it, it'll go away. And we need this conference to help those imams understand that to be better at your job, you need to understand that this is a little bit more complicated. So I want to commend those who get it, and the ones who are not so sure, I want to thank them for coming, because there's a lot to learn, and there's hope on the other side.
You also mentioned a little bit about where does the Muslim world come from in the United States. I'm seeing Mujahid Fletcher here, who started Islam in Spanish years ago, and it's grown so much. But Houston, like Minnesota, has a very large refugee population.
True.
Talk a little bit about that.
Let's just call the roll. In the very beginning, the Muslim community, much of it came from Africa. African-American Muslims, about when we were dragged from West Africa, as many as a third of the people were Muslim. And so you got this, and then you have the community that may have come from Afghanistan, who's seen decades of war and therefore tragedy. And then you have, I know Muslims who've come from Egypt who've spent time in, some dictator's prison, right? Add to that Syria, add to that other places. You might have Muslims who've come from all over the globe, who have found themselves in Houston because they needed to flee from, not everyone. Some people didn't come here that way. They decided to seek a better life, and it's not a problem. But there are many of us who have seen things and survived things that if we talked about them, we feel like we would shatter into a million pieces of glass. I can tell you in the Somali community how many conversations I've been in where people just say, I can't even talk about it. I can't even talk about it. And so we've got to be able to be sensitive to who we are, a diverse collection of people from Asia, Africa, Europe, and here, and Latin America, a growing, and Europe, right? Think about Srebrenica. Think about Bosnian Muslims and what they went through. They murdered 8,000 men and boys in Srebrenica. Think about the people who survived that tragedy. So we are in many ways a community that needs to really deal with some of the things we've seen and been through. And, quite honestly, every Muslim should be sympathetic and have a heart for people who've suffered trauma, because we know that the Sahaba suffered trauma, right? Being displaced from the very beginning, having to flee your home to Abyssinia because of what your relatives and tribal members were going to do to you. Understanding that Prophet Muhammad, peace and blessings be upon him, his father died before he was born, and his mother died before he was about 6 years old. And the woman who wet nursed him was so poor she could not eat enough calories even to feed him adequately at times. Our community, I don't care if you own 27 houses and have a boat and a plane and all whatever wealth that God has blessed you with, you come from a community that has seen trauma. And so you cannot say, that's not me, I don't know nothing about that. Right. So I just say, we come from diverse places. We've got a meeting, but we're unified. And so we've got to use our unity to confront this challenge.
You and I were talking about suicides, and especially amongst young people. Do you want to talk a little bit about what's happening around the country in the Muslim community?
Well, let's just say one thing about suicide. It's a permanent solution to a temporary problem. It's a permanent solution to a temporary problem. And let's also say this. It doesn't do much good to tell anyone it is haram. They know it's haram. They know it is. That's not a news flash. It's like, oh, it's haram? No, we know that. But if somebody feels so horrible and hopeless inside that they think that that is a better option, that they think their loved ones would be better off without them there, that they think what's going on in their mind is that somehow it would be an act of mercy to everyone else if they eliminated themselves. That is a person who we've got to have compassion for, intervention for, and we've got to help them know there is another path. And to shake a finger at them and, judge them, that's like the last thing they need at that moment. And so I will tell you that this is a very serious problem all over the country. As you noted, my life experiences have brought me to rural places, urban places, suburban places, north, south, east, west, central. In the court, it's a funny thing. I did not know when I first ran for Congress in 2006 that it would bring me to every single state in the union and a whole lot of places beyond that. And not just in the various states. We don't stay in Los Angeles. We go out to, we go to Fremont. We don't just stay in Houston. We go to, the rural parts, the small towns, sit with people there. You'd be surprised at how many masjids there are in really small towns, like Faribault, Minnesota. People are like, there's Muslims in Faribault, Minnesota? Yep, there is, and they're about to start a mosque in Northfield. I mean, it's just all over, right? And so what I'm saying is that I've been able to hear stories from diverse groups of people, and I can tell you that this issue of suicide is very serious. And I will say this, and I know I'm in Texas, so I'm going to watch my words, but these guns are not helping in the availability of them. The fact that you could walk up to a store and buy a gun so easily, I mean, if there were a cooling off period, you may not need any more than around 2 or 3 days to get somebody back into their right mindset. But if they can walk out of their home, go to a store, get a gun and bullets, and be done with it within 20 minutes, they're still in that zone of crisis. And it would be helpful if we think more about that. Guns take a lot of lives when it comes to suicide. And the ready availability is to our disadvantage, and I think we need to really think about that. Yeah.
You've traveled, you've visited communities around the United States, Muslim communities, and you talked about from a mental health standpoint. Since you've taken over and now the Attorney General of the state of Minnesota, what have you learned about mental health in that role?
Thanks for asking that, Mustafa. The one thing I've learned about mental health, see, in Congress, you kind of go a lot of places, but you don't really stay in the Attorney General's office. We work on cases. That means you got to go deeper rather than just, you don't need to cover a lot of bases. You need to go deep on what you are doing. And I can tell you that I am absolutely certain that it's not even just suicide, it's addiction. A lot of Muslims dealing with addiction. A lot of Muslims who have DUIs, and let me tell you, they don't come to the mosque to talk about them. They're ashamed, they're embarrassed, and they think they're not welcome. And we have got to find, here's the thing about it. If you open up the Quran, on nearly every surah starts out with Bismillah ar-Rahman ar-Rahim. So we know Allah is compassionate and merciful, but we're not. We ain't that merciful. We're kind of judgmental. Am I misstating the truth up here? if we 5 times a day at least pray to the most compassionate and the most merciful, we might want to tap into some of our own compassion and mercy. I think so. And so I would say that as Attorney General, it's my job to enforce the law. I need to be in touch with you all because I'm ready to sue companies that misrepresent the addictive power of their products. And when we're settling the cases, it's important for us to be in touch because as we resolve a case, would say, I don't know, some big company, Purdue, Pharma, whoever, one of the things we can say is that as the money gets distributed, it's got to be distributed in a way that is equitable and fair and gets to everyone. So we make sure it gets to our Native American tribal communities. We make sure it gets to the inner city and to the rural areas, and we make sure it gets to the Muslim community. And some people will say, to the Muslim community, they don't get high. I'm like, well, that's the story we tell. But, you know, hey, look, most of the world's poppy doesn't come out of Afghanistan for, you know, and no Muslims are, right? If we're just going to keep it real for a moment. And so we need to confront this problem and bear in mind that a person is better than the worst thing they ever did. They can reform, they can get better, they can heal, and most of them don't want to be stuck in the situation that they're in, and they like to be free of it, but they just don't know how. And that's where we come in.
I see the Consul General here from Pakistan here. You can apply. It's okay. Can you talk to a little bit of the immigrant community that's come, that's done well,
Sure.
that lives in, you know, nice homes in the suburbs? What message do you have for them when it comes to mental health and their children?
You know, the one thing about those amongst us who've been blessed to have physical comfort is that, you know, alhamdulillah, we're so proud of your achievement. You need to know that. We believe in you. We think that you're an example. It's a good thing. But one thing you know if you've achieved some material comfort in life is that you know that life is not perfect just because you've received some material comfort. Anybody who's done really well economically pretty soon finds out that they thought money could solve a lot of problems, but still they got problems.
Yep.
So we need to remember to keep our circle of compassion big enough for the poor and the not poor, right? We've got to remember that everybody has these challenges.
Yes.
The other thing to remember is that part of what compassion means, like the definition of compassion, is to remember that no matter what your station is in life, we all have an essential unity. You are connected to that person who's living in a tent under a bridge, even if you are living in a 27-room mansion and have a yacht outside. Mm-hmm. You're still a person. They're still connected. And this compassion should propel you to say, look, I know that money doesn't solve every problem because I've got a lot of money and I still got problems. But because I know that, I'm going to take some of my wherewithal and I'm going to help be part of the solution. So I do want to thank you all for continuing to be generous with what you've been blessed with, to continue to share it. But don't just share your money. Don't just write a check and say, see y'all later. Write that check. Need you to write the check. But we also need you to follow up with that check. Follow that check into the meeting. Sit down. Listen to what the problems are. Figure out what's going on with what you're supporting. And you know, you didn't know, unless you were just, even if you were just born with the money, probably you weren't, but even if you were, you probably have learned something about money management. You probably have learned a lot of skills that you can benefit to make sure that your dollar goes even further. So don't lead, so be generous. It's our requirement as Muslims to be generous, but just don't send the money and go. Send the money and stay and be part of the solution. You probably were able to make some of that money because you are creative, because you're innovative, because you know something about risk-taking, because you know something about organization and financial management, and bring those skills with you too. And can I wrap up with one quick story? Shortly after Ferguson, you all remember Ferguson?
Yeah.
I went there, and somebody said, Keith, we want to show you our clinic. And the person who said this to me was an African-American Christian person, African-American Baptist Christian minister. So I'm like, sure, I'd love to see it. They said, well, here's where the riot was, and here's where Michael Brown got killed, and here's this, and here's that. Come see our clinic. So I go into a church, and inside the church, I see a banner that says, Salam Clinic. And out comes the Pakistani doctors. So these black Christian ministers and these Pakistani Muslim doctors collaborating to look after the health needs of the people. Alhamdulillah. This is the kind of collaboration we've got to do. This is the kind of thing we've got to build on. We've got to understand that this is, and so what about this mental health issue? There's room for us to come together and help solve the people's needs together. I think it would be pleasing in the eyes of Almighty God. So with that, here's the thing. When it comes to pharmaceutical drugs, the market is just broken. It doesn't work. As Attorney General, I can tell you that one of the very first things that I did is I pulled together a study to talk about why pharmaceutical drug prices are just defy the forces of supply and demand. And it's not just the brands, it's the generics too. I got a lawsuit against 40 generic drug manufacturers for illegal conspiracy to hold prices up high. And I know that insulin is not a psychiatric drug, but I can tell you that if you are in Detroit, because you're from Michigan, if you drive across to Windsor, you probably can get the insulin for 10% of what the insulin costs in Detroit, right? And it's just wrong. Part of what we can do together is fight to lower these pharmaceutical drugs. We're bringing antitrust lawsuits against these folks to try to straighten this market out and stop what I believe is patent abuse. I could talk a long time about patent abuse, but my office is focused on it. Now, on the other thing is psychiatry. Look, compared to a working class person, psychiatrists make way, way, way more. But compared to other doctors, what the psychiatrist can bill for, I don't think is fair at all. And I think if you want more medical students going into psychiatry, we've got to deal with the insurance company to make sure that when they code, that it is fair for the time that they're putting in. Yep. At this point, it is a real problem. And then I'll just finally wrap up by saying that we are in a crisis. I mean, everything's a crisis. No, it isn't, but this is. In rural parts, I'm sure, of Michigan and certainly Minnesota, you have people, and I've had families in tears saying, my son is schizophrenic. We don't know what's going to happen. And they're telling us we won't be able to get into a psychiatrist for 6 months. Thank God for telemedicine. It's probably helped you a lot. But my point is, we need more psychiatrists, psychologists, psychiatric social workers. We need more people working on this problem. And so thank you for doing it, and thanks for your question.
Thank you so much.
Lunch is going to be served, right?
Yes, so if I could, do you have some final remarks?
I just wanted to end with this, because I know you wear a lot of titles, a lot of hats, right? But one thing that I think in this room would be helpful for you to talk about as a father, and I want to end with that, because I think that a lot of us have children in this country, we're raising children in this country. What advice do you give to, in the context of mental health and your children? And then after that, I think we're going to be serving lunch.
Well, God's blessed me with 4 beautiful children. They're all adults. And I can't tell you which one because I don't want to invade their privacy, but I will tell you that one of them really has had very serious problems with issues of anxiety and depression. And they were debilitating for this child of mine. And nothing hurt me more than to have this child of mine say, I was too embarrassed to tell you because I know all you guys are lawyers and attorneys general and all this kind of stuff, and I just felt like a failure. And I didn't want to say anything because now think about you and your degrees and all the money you made and all the people who respect you. And think about the pressure that may put on your child. And think about the subtle pressure you might put on your child. Your grades don't look good. Look, I'm not telling you to ask, I want you to ask them to reach high. But I also want you to remember that your child is infinitely more important than the grades on that report card. And if you put so much pressure on that child, you know, and everybody has different gifts. So I would say get the help, get it soon, don't judge, and remember it's going to get better, inshallah. Thank you.
And on that beautiful note, I'd like to invite Mr. Rapani and some of our committee members for a token of appreciation. So on your table, you'll see a piece of paper. If you could just wave it up for me to make sure you have it. Piece of paper, which is a way to indicate ways that you can engage with this type of conference in the future. Again, to share your time, treasure, and talent with us. Each of you can be a part of our core planning committee in the future. I'd love to see your gifts shared with us in the near future. Now, logistically, as they take, again, their beautiful photos, we will be now breaking for prayers and lunch. I'll be announcing you by table number, so we're being really organized, inshallah. So nobody panic. We will all be fed, inshallah. Lunch is going to be served in the front, on this side, kind of outside of the ballroom. And it will be halal food. Everything, I've been assured, from the sauces to the meats are halal. So each to your heart's desire. It's a combination of some restaurants and some local foods. Of course, they're actually South Asian, which is one of my favorites. Well, welcome back, everyone. I know we still have many of our friends in the ice cream line, but as we begin the next segment of our program, I'd like to ask the Chief Operating Officer of Ibn Sina Foundation Board to come and introduce the chief guest, Mr. Laikat Khawaja. Laikat, are you here? So please help me in welcoming Mayor Sylvester Turner into our conference. In the meantime, please make sure to fill out the documents that are on your table. Please raise your hand if you've already filled out a form. Let's celebrate the people that follow instructions. But also for volunteering their time, talent, and treasure, because we could not do these conferences without the support of our volunteers. So please do, I must reiterate this, please take some time to fill out the forms that are on your table. If you need some pens, please ask one of our volunteers. And there'll be plenty of opportunities for photos and media after the speaking. So please, I'd like to invite the media to take photos after the program, please. And Mayor Turner, I invite you to join us at the front, inshallah, so we can kick off the next portion of our program. Again, let's welcome our mayor who's joining us in the front seats, Mayor Turner. And now I'd like to invite Laika Shaukat, the Chief Operating Officer of Ibn Sina, to do a brief introduction. Thank you.
Bismillahir Rahmanir Rahim. Assalamu alaikum. Good afternoon. I am here to introduce the Mayor of City of Houston, Sylvester Turner. It is my great privilege to introduce the chief guest of the Muslim Mental Health Conference for Community Leaders. Mayor Turner has expertly managed many significant challenges in the city, including the budget deficits, homelessness, and natural disasters like Hurricane Harvey and recently the COVID-19 pandemic. Mayor Turner is nationally recognized leader and participates in numerous organizations as a lead. Mayor Turner has been a great supporter of health and mental health. I want to just say a quote from Mayor Turner's one speech. He says, "We talk about cancer, Alzheimer's, and heart disease, but we shy away from talking about mental health. Nearly 1 in 3 Americans will have a mental health condition in their lifetime, so it is just as prevalent as some of the other diseases. It's treatable, manageable, and people can live normal lives if they get help they need in a timely manner. We are privileged that Mayor Turner with us today for this Muslim Mental Health Conference. Let's welcome Mayor Turner to the stage. Thank you.
And let me thank you from the very beginning for a very gracious introduction. And let me just start off by apologizing because I so wanted to be with you this morning. And I know that Congressman Al Green was here this morning, and I think he announced like one of those community grants earmarks of like $1.6 million to our Sina Foundation. So even in his absence, let me thank Congressman Al Green of the 9th Congressional District. He has been a huge supporter to the city of Houston, to his whole entire congressional district. And he's someone who deeply believes in diversity. And he has been very intentional in his support of the Muslim community. So again, give it up to Congressman Al Green of the 9th Congressional District. Let me start off also by acknowledging the Consul General of Pakistan. It is always an honor to be with you, and thank you for your support. I appreciate that. We got Honorary Consul General Marty McVeigh is also here. Let me thank you. Zaf Tahir, who is on the Planning Commission. Let me thank you for also being present. And then someone who I have admired at a distance and just honored when I walked in and see him sitting at the table, and that's the Attorney General from Minnesota, Keith Ellison. A former member of Congress, one of the few Muslims in Congress, but hopefully that number will continue to grow. But certainly someone who is representing the state of Minnesota extremely well. But I'm going to add, not only representing the state of Minnesota, but quite frankly, he is a positive voice for many across the country. So let me thank him for his stellar leadership. Give a Houston welcome to Attorney General Keith Ellison. Come on, you can do better than that. To the Attorney General, you know. He does not shy away from his Muslim faith, and let me tell you, he has had to preside over some very tough cases in our country, but his leadership has been stellar. And then to take a 5 o'clock flight this morning to be here in the Houston region speaks volumes. So, Attorney General, thank you for gracing us with your presence. Certainly want to thank the Alliance for all the work that they continue to do in our city. Give it up to the Alliance and to the Executive Director, a close partner a close partner with the city of Houston, and they're doing some terrific things. Look, part of my speech is just thanking a lot of people today. And then I can't go too much further without thanking Dr. Asim Shah. He has just been incredible, an incredible partner with the city, what he's doing over at Ben Taub, what he's doing in terms of mental health services, speaks volumes, a very good friend. So Dr. Shah, thank you so very much for what you continue to do. Something major is going on. So he's just been on the front lines for so many, many years, whether it's in the Muslim community, whether it's when it comes to transportation and transit, whether it's just on the political dynamics across the board, talking about and advancing diversity and multiculturalism. Mustafa, thank you for very much. And the Muhammad Sheikh, I have to acknowledge this guy, because when it comes to our iftar dinners, and what we have done on that front, he has provided leadership for our iftar dinners. I think we have one of the largest iftar dinners in the country. Of course, the goal is to have 3,000 next year for our iftar dinner. It's my last year, so everything next year must be big. You know, it's either big or go home. And so, Muhammad, I'm looking forward to working with you. So many others. I saved the person intentionally at this point. When you talk about Sina, the foundation, you know, leadership is important. And Rapani has just been amazing over the last 21 years, because I believe the Sina Foundation, the clinic, came into existence in 2001. And and the growth, especially as we can talk about health care, but unless it's available and accessible, you can have it in your city. But if it's not available and accessible, for those who don't have it, they just don't have it. And the Sina Foundation is living up to its name, because there was this young person years ago, this 17-year-old person, really who was the doctor of all doctors. And I've seen even back then, the focus was on healthcare and accessibility. And I call him Dr. Rapani. I know he's not, but when you're meeting the needs of people, I'm gonna give him the honorary title of Dr. Rapani. But he and his family, they've been on the front line and have grown now some 6 clinics. I think if you include the Beaumont area, up in that area, is it 6 or 7? It's 7, some 7 clinics providing health care on multiple services. And even during COVID, they did not stop. Well over 200,000 visits, even during the COVID time. Please, give it up to Sina. So to Dr. Rapani, to his entire team, to the entire staff, going back to 2001, they started off with 1 person. Now he's probably got a staff of close to 80 or so, if not more. But now the fourth largest provider in the Houston area. And today, this conference on mental health is speaking directly to all of us. Because in this city, in our region, we have faced 7 federally declared disasters in just the last 7 years. We've gone through tropical storms, hurricanes. We've gone through COVID for 2+ years. We faced the winter storms, social, civil unrest. You name it, we have experienced it in our city. People literally have had to rechange their lives in so many different fronts. And mental behavioral health is major. It's really at the top of the line. And as the city invests more in crisis intervention, you really want to get to people before they fall in a state of crisis. You want to get to them as soon as possible. And in the Muslim community, when you start talking about mental health, behavioral health, suicide, these are real issues. And we can talk about it or not talk about it, but it doesn't change what is occurring in our respective communities. And in the city of Houston, the Houston region, we have the largest Muslim population in the entire Southwest, the largest Muslim population, which means that you have to attend to everybody's needs. And I'm not talking about foreigners. I'm not talking about people who are living someplace else and they are visiting our city. I'm talking about Muslims who are Houstonians, who live in our region, who help shape and make our city the great city that it is, who live here, work here, play here. They need to make sure, we need to make sure that we are providing services to people who live here, who are Houstonians, who happen to be Muslims, but at the same time who are facing anxiety and stress like anybody else. And this foundation is meeting those mental health challenges. And for that, I am very, very gracious. You can talk about being diverse, but you can be diverse all day long. But if you're not being diverse and inclusive and making sure that all of the resources that are available in our city are made available to every Houstonian, regardless of their faith, then you're not doing very much at all. And so I am so happy that this conference is taking place. I told Dr. Rapani when he announced it when we were at the manager luncheon, if there was any way possible, I was going to be here on the 14th. And when we changed some things around, I am glad that I'm here to place an emphasis on how important it is. And then lastly, what I will say is, I don't talk about mental illness and behavioral health as if it's in your home or in your home or in your home. I speak about it because it has been in my home. It's been in my home. And when you come out of a household where neither one of your parents graduated from high school, and if you come out of a household where there was no private health insurance, okay, no private health insurance, and you come out of a household where your dad died of cancer at 13, and the only thing he had to treat his problem, leukemia, was just some painkillers. That's the only thing that my daddy had. And my dad was from that school of thought, I got 9 kids I need to feed, and I'm just going to do the best that I can. My dad worked until the night before he got to the point he could not make it, and he died the next day. It was that mom, that maid, who picked up the baton, and a brother who was suffering with mental behavioral health issues, and my mom would take 2 buses to go to Bentab to get the medicine or get the help that was needed. And back then, what they said to my mom, and I was right there with her riding that bus, that until he was of danger to himself or somebody else, there's really not much we can do for you. And send us back home. And then you have to deal with it within the confines of your own home. And even back then, and to some degree today, nobody talked about it. We didn't have that conversation. We didn't talk about it. We just tried to deal with it within the confines of our own home. And that's when I said to myself in high school, it is hell to be poor. It's hell to be poor. Because it seemed like nobody gives a darn. And so here's my mama struggling to take care of 9 kids. One of them is having mental health issues, not getting any help, and you're dealing with it the very best you can. And so it is important for us to be very intentional, to give what we can, to be very supportive, to invest in foundations like the Abyssinian Foundation. Because the reality is the person that you help tomorrow or a month or a year from now may very well be that member of your own family. But for the grace of God, we could find ourselves in those very same shoes. It was mental health that drove me into public service. It was mental health because why I became a legislator, okay? And that's why I went to the legislature. Not for all these other stuff. I went to the legislature because I said, if God blessed me to be put in a position where I could change the lives for other families who were dealing with stuff just like my family dealt with, and that's what I intended to do. And it's because of that, Dr. Rapani, I wanted to be here today to thank you, personally to thank you, to thank the Abyssini Foundation, to thank those who are investing, and to make sure let's not treat it as a stigma. Because on any given day and time, all of us may need a little help. Thank you so very much. I'm so proud of what the Abyssini Foundation is doing. Thank you.
It's not easy to share the vulnerability of those stories, but truly those are the stories that each of us can resonate with. So let's do another round of applause again for the vulnerability of that sharing. Dr. Asim Shah. A round of applause, please, for Dr. Asim Shah. Next, I have Dr. Nidal Mukaddam. Thank you for your presentation on addiction. We learned so much. Dr. Sophia Banu. Round of applause for a wonderful presentation on youth and mental health. Next, Dr. Farha Abbasi. Thank you for your presentation. Dr. Farha Abbasi. Round of applause for her wonderful presentation. And last but not least, Sadia Jalali. Sadia Jalali, who will be leading one of our breakout sessions, so don't miss it. Sadia Jalali, round of applause for Sadia, please. Okay, so one of the breakout sessions that we'll be having next is mental health issues among refugees. I believe it was Attorney General Keith Ellison that said that the waves of Muslims in this community is what I like to call a trauma sandwich.
Assalamu alaikum. My name is Sharik Abdul Ghani, and thank you all for being a part of the Muslim Mental Health Conference here today. I am moderating the current session with none other than Dr. Sophia Banu. Dr. Sophia Banu is a contemporary of Dr. Asim Shah, who is also one of the organizers of the conference. For those of you who are unaware, the Alliance is one of the 5 key resettlement agencies here in the Houston area who are responsible for working with the federal government to resettle refugees that aren't coming just from Afghanistan, but Iraq, Myanmar, and many other places from around the world as well. Today's topic has a direct focus on the issue of refugees and their mental health, which, as you all know, here in the city of Houston, we've been incredibly welcoming YMCA and others, as well as Muslim organizations such as Olive Branch and An-Nisa Hope Center that work on the issue of ensuring that Afghan refugees and other refugees are integrated here in the great city of Houston. But just to kick things off, Dr. Sophia Banu, thank you. Welcome.
Thank you very much. Glad to be here.
Dr. Banu, would you mind just starting us off by telling us a little bit about yourself? How is it that someone in psychiatry decided, I'm going to find refugees as my specialty?
So thank you for giving me this opportunity. So before I became a psychiatrist, right after medical school, I went to Nepal from India to visit a family member, and there I met a friend of mine who was a social worker, and she told me, why don't you join us? We need a female physician. So I wasn't a psychiatrist at that time. We had lots of women who have been raped and tortured, and we really need a female physician. We have lots of male physicians, and our women folk who've been tortured will not go see a male doctor because of tradition and culture issues, barriers. So I decided to join the Center for Victims of Torture in Nepal. And that's how my journey started with the refugees. And one of my first patients, clients that I saw was a Tibetan nun who had been tortured in Tibet. And she had managed to leave and come to Nepal on her way to India to meet her leader, the Dalai Lama. And so she was, and I was documenting torture survivors' cases because I was just an MBBS. I hadn't specialized in psychiatry. So I was just documenting her torture case and, taking care of her wounds and upper respiratory infections. And then she was telling me how she'd been tortured, and I was getting really angry and upset at what had happened to her. And I asked her, you must be really angry at what happened to you, what they did to you. And she just looked at me and she said, no, I'm not angry. I actually feel bad for them that they had been born with such bad karma. That she, as Buddhists, they believe in the next life, she would pray that they would be reborn as better human beings. And that's how she dealt with her trauma, that's how so hearing a story like that and many, many, many stories, that's how my journey with refugees and survivors of torture started.
As you talk about survivors of torture, I imagine that most Muslims, most residents here in the Houston area, when they hear refugees, they think of people who have survived torture, who have survived bombs, who have survived mass disasters, who have survived war and all sorts of trauma. These are assumptions. Could you paint us a picture of the mental health conditions, of the mental health status of our arriving refugee neighbors?
Sure. So before I answer that question, in the audience, I want some participation. I'm going to ask a question. I would like everyone here, as many as you can, to think about 3 things that you cannot live without. Just think, you can close your eyes, or you can just think 3 things that you cannot possibly live without. And it doesn't have to be, materialistic things. It could be anything. It could be an ideology. It could be your car. It could be your pet. And if I could have some volunteers to share their 3 things. Mr. Sharik, do you want to go?
I can't live without my daughter.
Your daughter?
My daughter.
Okay, 1. That's it.
Okay, so my daughter, my laptop, and my coffee.
And your coffee, okay.
I feel so bad, What is wrong? Why do I worry? Why do I hyper focus on certain things? All these different symptoms they're feeling and they don't understand where it's coming from. What we have to understand, and just now is becoming a great researched area, is how generational trauma affects the future generations. If your previous history, your family background and experienced a lot of trauma, that's going to play out for future generations. Okay, and there may not be a direct tie, there may not be a direct trigger to why this is happening, but we have to acknowledge that it's real, and it is happening. So the lack of understanding this makes people not want to acknowledge it, therefore not seek services, right? So, the other piece also is we also have a lack of understanding of abusive behavior. And unfortunately, our community is not immune to, domestic violence, domestic abuse, different other types of abusive behavior that, we actually see quite a bit in our families. And it is, as we all know, incredibly toxic. It's toxic for every single person involved, right? And if we don't even know that that's abuse, we don't know, often we don't count emotional, mental, verbal, we don't count those as abuse. So the effects keep going, but we're not doing anything to identify the root cause or the problems, right? So we have to, having more education about abusive behavior will help people, focus on getting that help that they need to see, oh, that's what's going on. Oh, that's why I feel this way. That there's some abusive behavior going on here. But certainly there's not causation, and I think that's a big line we have to draw. Okay, I do believe there's interplay. I think our faith does inform, has some parts to play in our mental health, but there is not causation. You don't have mental health issues because you don't believe in nothing. Essentially, during her job, which was a I talk to people job, basically had a full-blown panic attack, okay, on that first day. You know, and imagine what that does to that person. Finally gets the courage, gets the, you know, and is excited about this new opportunity, and then, I mean, just, you know. It's very, very important. You know, there was a study I was reading in the past from an Islamic psychological organization overseas that was studying this, you know, how often is it actually jinn possession compared to psychiatric issues which cause hallucinations, delusional behavior, like a lot of psychotic thoughts and behaviors. So,
Thank you for sharing. So I want you guys to imagine whoever volunteered the things that they love the most, that's dear the most. Can you imagine, just close your eyes and imagine all of the things, and I know it's hurtful for me to say that these things that you said you loved is being forcibly taken away from you, that you need to leave right now this ballroom place. You cannot take the things that you said you were dear to you, and you have to flee for your life. Leave your house, leave your family, leave your laptop, hygiene products. You cannot take a walk, Dan. You cannot be with your friends. And that's how a refugee comes to your office, having lost everything, lost their freedom to pray, to walk, lost their family members, lost their homes, lost their laptops. And that's how somebody comes to your office. And so, of course, the trauma that they're going to be suffering from, the post-traumatic symptoms would be PTSD, major depression, anxiety, and all of that. So I don't know if that paints a picture of what you're trying to say.
It paints a picture, but is this true of every single refugee who arrives in this country? Because you have men, you have women, you have children of all ages. Even amongst the men and the women, you have men and women of all ages, right? Who some may have served in combat, some may have been victims of combat. Right? So could you give us a little bit more of a nuanced view of who's arriving in this country?
Sure. So, you know, the definition refugees was started by the United Nations High Commission when it was created. UNHCR was created after the Second World War. And they defined a refugee as somebody who's forced to flee his home or his country because of fear of violence, war, and persecution, and they cannot return home based on that fear, that they cannot, their lives would be in danger if they returned home. So yes, you're right. You know, the whole family that comes as a refugee, from the smallest, the youngest to the oldest, will have suffered, even though it may not be directly trauma, like, you know, the man may have been tortured in prison, but the wife who's at home is not tortured, but she suffered as a consequence of the husband being in prison, right? The children were not able to go to school, their house burned down, and then they were forced to flee, and then they're here. So not everybody goes through the same trauma, not everybody gets tortured, but having to leave what you know is familiar, you know, what your house, your family, that in itself is trauma, you know. And then the other trauma is from South America and Central America, right? They're fleeing gang violence, right? So not everybody was, you know, had been through gang violence. Not everybody was, you know, suffered but because they wanted to flee that particular situation, they have been traumatized too, you know, having to leave their country, leave their homes, leave their families. So, I don't know, does that answer your question?
No, that absolutely answers it. It provides it really paints a picture of the needs that many of the refugees will face when they arrive, and those that are already here. Right? Refugees have been coming in this country since it was founded.
Yes.
Right? Muslim refugees have been coming in since, at least as from what I can remember, the Yugoslavian war, right? Where our brothers and sisters from Bosnia and Albania and others would come into this country seeking refuge. And even before then, we had victims of other wars and conflicts that would arrive on our shores. But speaking of the current slate of refugees who have arrived, the Afghan refugees, and the ones who are still living on many of the air bases and they're still moving to the population centers, what kind of mental health services do they need versus what they're getting? Right? We're very fortunate to live in a time right now to where society is so keen on mental health services, mental health issues, and talking about mental health in a positive way. In fact, I think we're sitting at the first ever Muslim mental health conference in the state of Texas. So we see the dynamic of our community shifting in a very specific way. So if you could paint us a little bit of a picture of what kind of services are out there versus what are they actually getting?
So what kind of services do they need? Definitely mental health services, which provides psychiatry, as well as counseling, as well as group therapy, as well as social support, psychosocial support. So I am very fortunate, and I have Dan here in the audience, and Dr. Sharma somewhere around here, to have a mental health clinic that offers free services. And Alliance is the one that came up with this. Dan and I, we work together. So we offer free services to anybody who walks in through the doors of Alliance. Primarily for refugees, but also the underserved population, So we provide psychiatric evaluation. We have a child therapist. We have an adult therapist. We have a program specialist. So we also do community wellness education classes with medical students and residents in the community. So we do that, and also we provide, we do food drives, we do hygiene package drives. So we do a lot of this, but the need is so much more than what we're doing. We definitely need more psychiatrists. We definitely need more therapists. We definitely need more program specialists. So there's always a need, because right now at Alliance has just resettled about 1,400 Afghan allies. We call them allies because they didn't come through the usual route that a refugee does. A refugee comes after being registered by UNHCR, having gone through vetting process, which takes years. Afghan allies were just like, because of the situation, they came through a different route. So we've resettled about 1,400, just Alliance, and every other day I get a referral for a new client, And so definitely there's a bigger need for mental health services. There's a bigger need for clinics like the one that Alliance has. So if anybody in the community is interested in joining us, if you have a psychiatrist or a therapist or a clinical social worker, please reach out to us, because every day, like I said, we get new referrals. And children, starting from the age of 3, I got a referral for a 3-year-old who's suffering from, and this is from Interfaith Ministries, She sent me an email saying that there's a child who's suffering from post-traumatic symptoms because of the way he's acting. The story she described was horrific. And this is just a 3-year-old child who will not leave the mother, and he's just clawing at her, because he's scared that something's going to happen to her. So,
Dr. Banu, could you tell us a story of a mother who you've worked with, who is a refugee or an ally? Describe this mother's mental health situation and what it takes to provide her the treatment that she needs.
So I have so many stories. So I'm going to reach back into my years at Bellevue Hospital. I saw this woman from, a mother from Liberia. She had been tortured by the rebels because she was a village vegetable vendor. She was out in the community selling vegetables, and she was she had a lot of opinions. She was a very loud, very boisterous woman, and she would be like, I don't like this government, she would voice opinions, and the government didn't like that, so they sent rebels against her, and they captured her, they raped her. She managed to escape, and they shot at her. So she had bullet scar wounds. So she came to Bellevue Hospital, and I saw her for psychiatric evaluation and decided to take her as a therapy patient. Started her on medication, and so one of the, every week I would see her, and then she would say, and I would ask her, how was your week? What did you do? Just chatting. And she would say, I was fasting, and I would say, that's strange. It's not Ramadan. It's not Yom Kippur. It's not Easter, and so then instead of just not saying anything, I asked her, every time I talk to you, you always say you're fasting. Why are you fasting? And then she looked at me and she said, I don't know if my children are alive. I don't know if they have food to eat. So when I try to eat food, my food gets stuck here, because she doesn't know whether her children have food to eat. She doesn't know if they were alive, And when I heard that, of course, I was in tears. We're human. Even if you're a psychiatrist, you're allowed to cry. So we were both in tears, and I had to tell her, I understand why you're feeling this or why you're doing this, but I don't want you hospitalized, because if you continue to fast like this, you're going to be hospitalized, and hospitalization is something that she definitely did not want. So I had to slowly sort of, talk to her, do more intensive therapy, and then I connected her with the social case manager who would do reunification for families, and to try to find her children and her husband and her mother who she had to leave behind. And slowly but surely, alhamdulillah, she got better. When I left New York, she had a job at Payless Shoes. I don't know if they have those stores anymore. She was working there. She had been reunified with her children. Her husband, unfortunately, had died. Her mom also had passed away, but she was reunited with her children. But that's one case that really sticks to my mind. And it teaches me to ask, not just, oh, you're fasting? Okay, let's go on to the next question, So if you ask questions directly, also, that's another lesson that I learned. To not just take it and just go with it, to follow what they're trying to tell you. I didn't know the extent of her desperation. I knew she was separated from her children, but I didn't know the extent of how she felt.
In that story, you took us from learning why she was fasting to her being a success story. How long did that take? How many sessions did it take? How many people had to intervene in order for her to go from point A to point Z?
I would say a village. It takes a village, like people say that. I would say at least 4 to 5 people over a couple of years. And that's a luxury, I have the luxury because of Dan and the Alliance of seeing Afghani clients right now where I can spend an hour and a half with an interpreter trying to talk about how life was back home. Not, I asked them about how life is here, but trying to see what their lives were like. I have the luxury of spending that time because I don't have 20-minute time slot or 60-minute time slot. I have an hour and a half, which is a luxury which I don't have in a regular clinic. I have access to interpreters. I have access to the community services. So, it takes a lot of people and a long time, but it can be done. That's the message I want to give.
I hear you that it can be done. And it can be done when we have providers such as yourself and we have organizations such as the Alliance, an entire community behind you and other providers to make it happen. But what I'm thinking about is all the mothers and the fathers and the children who slip through the cracks. Who slip through the cracks because we don't have enough services. We don't have enough Dr. Banus. We don't have enough DANs. We don't have enough of these organizations. Is it right to say that there are probably refugees who are slipping through the cracks? Tell us why.
Absolutely, absolutely. And that's a tragedy. As a psychiatrist, as a mental health provider, that is a huge tragedy because with help, with a little bit of help from the community, with a little bit of help from an agency, that person life's trajectory would have been completely different because, if you fall through the cracks means then you've succumbed to substance use, then you become homeless, then all the other issues that come after that. Or if you just become depressed, you're not able to take care of your family, and as a result, your whole family falls apart. That is a huge tragedy, and the reason I'm glad you brought this up because I think if all of us in the community help out a little bit, that the people falling through the cracks can be prevented. And that's the tragedy, but that's also the good side of it, that it can be prevented if the community works together.
Dr. Banu, forgive me, but I feel almost as if you're holding back. You're not painting us a candid enough picture. So I'll ask you a little bit more of a direct question.
Mm-hmm.
Tell me what it looks like when a Muslim woman refugee falls through the cracks. What does her life look like?
Oh, that's a tough question. I can't,
And please be as candid as possible because I believe that's why the leadership is here. And that's why people, this is what they will walk away with. We need these images in our mind. We need to understand exactly what the consequences of our actions or our lack of actions are.
I'm trying to think of a case, but I can't think of a case because if the case came to our clinic, that means they got treatment, right? So I got to think about stories that I've heard. I guess specifically of a Muslim woman, I don't know specifically whether they were Muslims or not, but I have heard of refugee women who have not had the treatment or who have not been in treatment, even though they had lots of issues because of either domestic violence or because of lack of services. I don't know, it's such a difficult question to answer.
Can I just interject?
Yes.
Help you out a little bit?
Sure.
My name's Afshan Jalani, and I do the best I can as an individual. Also work with Anissa Hope Center.
Yes.
So the most poignant story that I came in last week. So there's a single mom. There are actually quite a few single moms, Afghan refugees, who are falling through the cracks. And Sharik, I wanted to thank you for bringing that question up. But this young woman has 2 children. Her story is that the husband and her older son, they were all headed towards the plane, but the Taliban captured the husband and the older child. They literally pulled them apart from their hands. She made it on the plane and he did not. She doesn't know whether they're still alive or not. There's no contact. So I just want to offer my services as an individual and Anissa's as an organization. Please tell us how we can help you.
Yeah, thank you. Thank you for offering your service, and thank you for that question. So I think when we were talking about this session, we had a conversation about this. I told him that when I joined the Bellevue NYU program for survivors of torture, there were 2 Muslims. One was a revert and one was me. And 98% of the client population were all Muslims. So, that's one thing, right? We need more to, go into mental health fields if possible. The other thing that I shared with him was, I was seeing one of our clients at Alliance, and she's this mom who had to leave her children behind and came, like similar circumstances. And so she was in therapy with me, no medications, but she was just really sad and desperate, and she was looking for a job, and she was a principal of a school back home. And so I asked her, so how was it last week? What did you do? And she said, I had a wonderful time. I went to the beach. And I was like, you went to the beach? How do you go to the beach? Because I know she doesn't have a car. She just arrived. She said, 2 ladies came to my house. They introduced themselves. And they said, we are here to spend the day with you. What would you like to do? And they said, do you want to go to the beach? And they took her to the beach. And she said she felt so good just seeing the ocean and being on the beach. And I didn't know who these people were. The other example that I have is a friend of mine wanted to donate a crib, and he asked me, do you have a family that needs a crib, And I know that Afghan families have many, many kids, and some of them are newborn, and some of them a few months old. So I said, yeah, there's this family who has 9 kids, and they just had a baby, and can you please go and drop the crib off? So I gave him the address, and that after a few days he called me. I said, how did it go? He said it was good, but when I went there was a whole family, a Caucasian family, who was in their house helping them, And so my friend was like, why can't we do this? Why can't we as a Muslim community do this? Why can't we gather our resources together, moms and dads who stay home, or aunts and uncles who stay at home, or, on the free time, Saturdays and Sundays, why can't we create a community that we can go and knock on the doors of the newly arrived Afghani refugees and say, do you need help to go pick up your medication? Because I have that problem. I prescribe a medication, and for the medication to reach from the pharmacy to the door of the individual who needs it may take 2-3 days, and that's not right, because this person may have been suffering from sleep deprivation for days on end, and here I can give him something, nothing addictive, I do not prescribe anything addictive, to help him sleep or to help him calm down. Why would it take 3 days? If I had somebody helping me, connect the dots, that will make the lives of the Afghan refugees, or any refugees, so much more easier. I'm not saying it's going to make their problems go away. I'm not saying, overnight it's going to be a huge success, but I'm just thinking of ways that people in the community can help you. Not everybody has to be a social worker or a psychiatrist or a provider. You could just be a human being who cares for others and who wants to do a little bit to make somebody's life a little bit better. One step at a time.
So, Dr. Banu, that really takes us into the last question of our session. And it's a question that I've given to you, and it's a difficult question. Seeing as how the target audience of the conference this year is are Muslims in leadership positions, are Muslims who have an ability to affect some level of change in our community, or at least steer organizations, steer our masajid, steer our centers in a very specific direction. What are 3 action items that our Muslim leadership can accomplish within the next 3 months to start moving the needle for our refugee brothers and sisters?
Okay, that's an excellent question. So I think along the lines of the last answer, I would like our audience to actually create community groups. You know, you can create a family of 5, you know, let's say one Saturday, this family goes to Southwest Gulfton Apartments, you know, and you can contact me. I have so many patients that would need help. Please, so if you have time, if you have the energy, and if you have compassion, I want you to come with me. I want you to come and help, and the smile that you get back is worth more than anything. It's priceless. So that's one thing, right, to create communities. The other thing is I want you to be aware of what's going on in the world. I don't want you walking with blinders on your faces and just looking ahead. Take it out, look around you, what's happening. Read the news, but the actual news and not the fake news, because there are lots and lots of fake news that gets perpetuated over and over again. And this is something I tell all my medical students and residents. Whatever you share, make sure it comes from a good source and not just something that you heard and you shared, because there are lots of misconceptions about what's happening in the world. You have to be aware of what's going on. The third thing is I do food drives, and Dan knows that. You know, I do food drives, but my food drives are very different. I actually take high school students with me shopping to Costco, and then I take them to Al Madina on Hillcroft, and then I teach them about what kind of rice does a Congolese family eat, what kind of lentil does an Afghani family eat, what kind of, of savia, for the Afghanis, what kind of, peanut butter is really a favorite for Congolese families, but peanut butter is not a favorite of Afghani families. Afghani families will not eat anything out of a can. You have to know this. If you give them lots of canned goods, it's going to go into the garbage. So I teach them this, and then we create boxes, and we go to the apartment complex, knock on the door, and say, here's, I get the names of case managers, of course, and then we drop them off, and the kids love it. And we started this during the pandemic, only because I thought most of my families who are single mothers who don't have a car, how can they get to a food bank? Elderly refugees suffering from COVID, how can they get to a food bank? They're inside the house. So that's how the food drive started 2 years ago, and it's still ongoing. Last week on Saturday, just before Eid, we had 120 people that we served in one apartment complex, just on a Saturday. And I had medical students and high school students, and I had a couple of parents come with me, and they were like, oh my God, we've never been in a store like this. I'm going to come back here with my wife. There's so many things I could buy. And then I have high school students saying, Dr. Banu, I've never had so much culture in my life. I mean, that was such a sweet thing to say. He said, I've never been exposed to so much culture in my life. So we're not just making boxes and dropping them off, we're actually seeing the people that you're actually helping. And I think that goes a long way to create awareness, teaching our children about what we can do. That's a long-winded answer, sorry.
No, that was a great answer, and I think it's an answer that we all needed to hear. So Dr. Banu, in essence, we can be doing more.
Absolutely.
We should be doing more, and it's upon all of us here in this room together to do more and to make a commitment within our organizations, within our communities, and even within our individual families to say, I have some spare time, I have the will, I have the compassion. And I'll end with this one hadith, and then I'll let you wrap it up, Dr. Banu. The Prophet ﷺ said that Allah subhanahu wa ta'ala has told him that if you take one step towards me, I will run towards you. So if you find it difficult to link up with an organization, or find it difficult to do something or steer your organization in the right direction, I want to remind you all that the only thing that you have to do is to make the intention, to make a difference, and then take one step outwards, and Allah subhanahu wa ta'ala will do the rest.
Absolutely, thank you so much. One last thing I wanted to share, charity starts at home, right? We all say that. So I want to just share this about my son, my oldest child, he's 18, And when he was 16, he started a Students for Refugees Club at his high school. And right now he has, it's the largest club in his high school, and he has so many students who want to do more because they do lectures, they invite people from outside, then they do this food drive with me. So teach your children about what life is like outside for a refugee. Open their eyes, and I'm not just talking about documentaries. Have them go to these places. Take them out and see where other people live. How do they survive? Because you will only make your child stronger if you do that. More, well equipped to handle any kind of stress that they come through in their lives when they see how other people survive.
Thank you, Dr. Banu. May Allah subhanahu wa ta'ala reward you immensely, and especially your son as well. I wonder where he gets his inspiration from. Thank you all for being in attendance today. And if you would like to learn more about Dr. Banu's work, please look up the Alliance on Google. I'm sure you can find their website very, very easily. Dr. Banu will also be around. I'm volunteering her to answer any additional questions. I know my dear friend, Brother Marfani, had a question as well, and then she'll be around to answer any questions you may have. Thank you again for your time. Assalamu alaikum.
Please make your way to your seats. Feel free to fill into the front seats. We have some availability in the front. We really want everyone to be up close and personal for the panel. Again, if we could quickly make our way to our table and to our chairs. I know there's much to debrief and discuss after these sessions. So I'll ask for your attention so that we can move on to the next segment of the program, the last segment of our program, which is the panel. All right, so the topic for this panel is Leader as a Healer, the role of community leaders in mental health. So our experts will share the critical role of community leaders in helping communities specifically suffering from mental health challenges. Dr. Farha Abbasi, Ayman Kabir, Ghazanfar Hashmi, and our moderator, Mustafa Tamiz. We will also have time for some questions, inshallah, after the panel, but only if you quickly make it to your chairs and we kick off the panel. So without further ado, I will pass it over to our moderator, Mustafa Tamiz, to kick off our Leader as a Healer, Role of a Community Leader in Mental Health and Wellness panel. A round of applause, please.
Assalamu alaikum. Auzu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. Being here today, being here all day, I know some of you are walking in from a separate session, so take a minute, find a seat. And I think the next discussion for us is a really important one, in that oftentimes, as someone involved in the community, people come to you for advice. They come to you to ask about their kids and how to navigate sometimes the system. And so we want to use this time together to talk a little bit about that. And I want all of us to listen from our own space. Listen from the space that if someone would come to you, what would you say? How would you help them? How would you support someone from the community that's in need? So with that, I want to start with Dr. Asim Shah. Dr. Shah, do you want to give advice to people that are on the front line in the community, and someone comes share something about their family? What should someone do if they don't know where to tell them to go?
So thank you, first of all, for that question. So when you think about frontline people of the community, I think you're talking about non-physician frontline or non-healthcare workers. There are many things they can do. So one of the purposes of today's conference was to create awareness, and I think we have done that very well. So congratulations, Mr. Rapani, for that. Why? Because first thing is awareness. We want the frontline workers, which includes teachers, imams, all the community leaders, to be aware of mental health. Think about it. Think about warning signs. Think about warning symptoms. And when they're aware of mental health, then they will think about it, of course, and then they need to refer them to professionals. Professionals can be many. They could be simple as even to going to a community mental health clinic, going to their primary care doctors, going to a psychiatrist, going to a therapist. And if you don't know anything, just remember one number, simply one number, which is a crisis number, which is 1-800-273-TALK. 1-800-273-TALK. And that one number can link a crisis to different things. So that's just one simple thing. Now, in our packet, which is provided to everybody, courtesy our Ibn Sina colleagues, there are tons of resources, and you can use all of that. So I guess the simple and short answer to your question is create awareness, create knowledge about what depression is, what anxiety is, how to prevent suicide, and then refer them to appropriate people. Don't just create a stigma and not talk about it. Don't shy off about talking about it. Don't just say hush hush and not discuss it. It's okay to discuss these things. And that's what we want to do, and that's what we are doing. And seeing a room full of people, even close to 4 o'clock, is amazing. So I'm really happy about that.
Thank you. So your approach and your outlook is different because you're in the media, you're in the community media. And sometimes people don't realize the importance of that community media when it comes to certain topics that, aren't fun, right? You're not talking about things that people want to talk about. What do you think is the role of the media in this?
Before I talk about the media, I think I should talk about this age. This age is postmodern. So in the postmodernism, people say that this is an end of postmodernism, but I say this is still, we are living in this age. And the characteristics of the postmodernism age is that it is characterized by the complexity, confusion, chaos, ambiguity, complexity, contradictions, paradoxes. So this is sort of things which affect the common people living in the society. So this leads towards to having anxiety and depression and different. And also the media is the product of the postmodernism age. So media is also the same thing. So when you see, when you watch any television drama or television news, you see that in one screen, in a very limited space of the screen, you see different things happening. One is news anchor, one scroll is at the bottom, one scroll is at the top, and there's another live coverage going on the one side of the screen, another. So bombardment of information is everywhere. So this is the characteristic of the postmodernism. In this bombardment of information, you cannot sift the information, you cannot go to the absolute truth. You cannot conclude with the absolute reality. So since the media has effects on the behavior, thinking, and attitude of the people, so the audience and the viewers, they are getting the direct influence. It's a bullet theory of the communication. It directs like a bullet on the minds of the people. So they think that what they are seeing, what they are watching on the screen, they say that this is the reality, but that is not the reality. So when they the media portrays the crisis and violence and the mental illness or something like that, it means they eulogizes it, fantasizes it romanticizes it. I remember the drama of Pakistan television and also the movie in which the thinking of suicide and the act of suicide was romanticized. So I think this trend and this approach should be stopped, and there should be a new thinking, because this is the age of social media. Everything is on the one thumb scroll away from a person, from a teenagers. So 81% of the teens are using social media, and 69% of the adults are using. So everything, every day, every second, we are getting something. So I think the main problem is the media's portrayal of this problem should be changed, and this approach should be changed. Media does not give the solution. Media only presenting a problem. So this is the problem actually.
Doctor, as we talk about solutions, you don't just look at it from the lens as a professional, but also somebody in the community. What do you think is lacking in our community when we tackle mental health?
How much truth can I say? Nothing
As
but the
much as you
truth.
want.
I'm good. I don't live here, so I can say it. I think when we talk about immigration and immigrant parents, I would like to start there first. I think we define success, even let's not say immigrant community, let's talk about American dream. Even if we talk about the American dream, we always talk in sense of consumer or like material achievement. And when we go to our roots, our culture, our religion, where serving, giving up, selflessness is what is promoted and encouraged, that's where the conflict is coming for your next generation. They see their parents are very particular about the ritual of Islam, going to the masjid, the culture of Islam, but they then see this division in the house where success is promoted as a material achievement. So I have a question here. When we are called the model minority, what kind of pressure are you putting on your youth? When you are giving them a model of success, so I, for longest resisted becoming part of Apna because of that reason, that Apna Bazaar had more value for people attending rather than the service. For once now, I see a tide of change, very well-intentioned physicians doing amazing work, not only here, but back home. But even now, when finally doctors' kids started getting affected by opiate overdoses and suicide, they finally started talking about mental health. And literally, we were standing there hoping that people would come into the hall and listen to us. And they said, "Arey chodo ji, ye wahi pagalpane ki baatein hain. Chalo bazaar chaliye." So that's where the community role comes in. Now I will talk about, I said that being in community can be the most healing resource. But what our kids are seeing is how many of the kids are here, I don't know, but the desi auntie. The desi auntie who's there to criticize or gossip, but not to validate and support. So until unless our community becomes inclusive, accepting, validating, we will not thrive. We will see these problems are creeping in. These problems are getting more and more ingrained, and we really have to wake up to that reality. So I ask you all, every Desi function I go to or Muslim community function I go to, I hear, what is your kid doing? My kid made it to this university. My kid is going to be a doctor. My kid is going to be this. What about the kids who cannot keep up? Are they not your kids? Don't we have a responsibility to them? What about people with autism, developmental delays? What about trauma? What about this, anxiety? So not every kid can end up in a but do we talk about that? Or another thing that we have started at our local Islamic center is, after Jummah prayers, how many times we pray for people going through surgery? We pray for people being hospitalized. Do we pray for people who are struggling with mental illnesses? So those are small changes where the community can be very, very helpful. So my question to each one of you is, because each one of you are the community, right? One thing I want you to take home today is, are you going to be a bystander or an upstander? Are you going to be part of the problem or are you going to be part of the solution? Because this mental health work starts with each one of you. Each one of you, you don't need me or Dr. Shah to come and tell you. You all know the truth. Stop shrouding it in silence and shame. Be an abstainer. So, thank you.
You know, we were talking about this when Attorney General Ellison was here. I've had the privilege of traveling around the country in visiting Muslim communities around the United States. And sometimes you don't realize it, but it's a significant blessing, right? And so as somebody who's done this for a long time, I value the Islamic Society of Greater Houston because it's the largest local Islamic society in the country, and we locally sometimes don't recognize that. ISG's general operating budget is larger than any Muslim organization, national or local. Right? So it's a big responsibility. So, we blame ISGH for everything, right? It's part of our culture. So you are dealing this at scale. Like sometimes people have to deal with it at a masjid level, at a local. You are dealing with the largest Islamic society with the most amount of imams that report to any other organization in the country. Right? What are the kinds of things, and I think even in participating with this, I know you and I have talked about this, but I'm sure there was some pushback with some people going, why are we talking about this? Can you for a minute, take your perspective and see what is going on the front lines, because that's really the big conversation here.
Thank you, Mustafa. Thanks to all of the attendees. Before I get to the question, I want us all to level set and calibrate on the topic of this panel discussion, and it's leader as a healer, right? But I want to remind myself and everyone in attendance today and echo what Dr. Abbasi said of what our beloved Prophet ﷺ said. He said, كُلُّكُمْ رَاعٍ وَكُلُّكُمْ مَسْئُولٌ عَنْ رَعِيَّتِهِ. All of you are shepherds, all of you are leaders, and each one of you as a leader is responsible for his and her own flock. Now we need to reflect on that a little bit. As we part ways today from the conference, awareness objective achieved, alhamdulillah. The question is how each and every one of us will play an important role in the larger Muslim community to address this mental health issue head on. So now that we know that each one of us is a leader, we have some homework to do, right? Just echoing what Dr. Abbasi said. Now, back to your comment, Mustafa, about ISGH and Muslim organizations, I want to start by giving a shout out to the imams and the religious leadership that we have across the country dealing with a lot of these issues, whether they're equipped or not equipped. And I know that oftentimes when we look at it from the perspective of professional help that's needed for people with mental health issues, we want our imams to be equipped with the right tools, background, and training to ensure that they're referring those cases in due time and ensuring that they get the resources and the help that they need. We recognize that issue. But talking about the scale that we're talking about here, this conference is a first step to mobilize the community, to recognize there is a problem, that's number one, and I think that's the barrier that we need to cross, and that's what we're doing with this effort and beyond, inshallah. But for our imams, we've been in the leadership in ISGH talking about this continuous education form that our imams need to have on continuous basis. Call it a monthly continuous education. This conference and attendance in the conference is part of that continuous education that the imams need to go through. Not only that, even the administration at the Islamic centers that we have across town. Now this expands to also the principals and the teachers, and shout out to all of the principals and teachers who made it here today. We're proud of you, alhamdulillah. But how are we going to be, Jazakumullah khair, Jazakumullah khair. Now, how are we going to address this? And I know we have not discussed this with the core committee or the organizing committee, but at the ISGH level, I tell you that we intend to have those quarterly mental health focused development and continuous education for all of the imams in the greater Houston area, not necessarily just for the ISGH imams. We recognize the issue. We know the experts, Dr. Shah and many others in this community. And besides the announcements we heard about Ibn Sina and the plans in Ibn Sina, let's give a shout out to the many smaller organizations who have been making strides at a smaller scale, trying to make a dent at the problem of mental health here in the greater Houston area. So inshallah, collectively, as one team, we'll be able to mobilize, we'll offer the resources that our religious leadership need, we'll make the awareness for the community in congregations on Friday prayers. This month is a mental health awareness month. So it is due and timely for our masajid to be given a khutbah that will focus on the awareness part of mental health issues. So it is a holistic issue that we're dealing with, and the community, quite frankly, is waiting for what we call an answer product. We're not there yet. We'll work towards that. We'll march collectively towards that, inshallah, and we'll need help from each and every one of you as leaders in the community to get that answer product in place, inshallah.
Mustafa, can I add one thing? You can consider it my second round term, maybe. Everybody recognizes that the media has a crucial role in dealing with this issue. But I have a complaint with the physicians and the organizations dealing with this issue. We cannot put blame on the media alone, actually. We are all actually responsible for this. You know that media can sensitize. Media can create awareness. Media can create hype about this. Media can give the solution. But can we utilize the media? Can we use the media for this cause? No. No organization has done something and approached the media to do something and to create awareness and to spread the message of this issue. No one has allocated funds for this. No one has approached regarding having a talk shows, having writing something, for documentary something. Maybe Dr. Asim Shah is doing something. But overall, I feel that there is a lot of room, lot can be done in this regard, and there should be an alliance between media, between the faith leaders, between the community leaders, to devise a strategy. This is a holistic, approach should be adopted and make something towards the solution of this problem. This is my take.
So to answer that, actually Ibn Sina has been sponsoring a talk show regarding mental health, mind and body for over 2 years. And for the first year we did only mental health, which is amazing. That was the only mental health show on one of our networks. I'm not going to name any network, but it was, and it's still on, so that's amazing. Another thing, just to what Dr. Abbasi said, it is amazing to see, and people talked about it multiple times, that 1 in 3, 1 in 4 people suffer from mental illness. There's so many people here. If you all think about it, if you all just, when you go home, 1 in 3, 1 in 4 is not a big number. And I'm sure you all know people who suffer from mental illness. And if you think about people, your friends, your neighbor, your cousins, your uncle, your aunt, your nephew, whoever, if you just take care of their mental health needs, take them to the doctor, remind them for the appointment. If they're not going to see the doctor, connect them to the dots. That's still a success. That's a huge success. So many of mental health people, so many people who are suffering from mental health disorders are not getting help they need. And remember, mental health is just like diabetes, hypertension. You need continuous help. People forget about that. People just get help for 6 weeks, 3 months, and then what? You need help ongoing. And that's the thing people miss. So you need, everybody's responsibility, including mine, to remind them, whoever is your loved one, remind them. Just like we remind our dear friends to don't eat sweets because you have diabetes, or don't take salt because you have hypertension, or don't take too much fatty stuff because you're getting fat. Remind them that if you have any depression or anxiety, to take your medicine, go see your doctor, go see your therapist. Do something about your health. This is very important. So anyone who is in this room, this is your responsibility today. If nothing else, this is your responsibility. This is your take-home message. So please remember that. Thank you.
Can I just add on? So I'll take it one step ahead. Sabse pehle to, I think the first step is do a self-audit. Check your mental health first. And I'll give you a simple tool to do that. So we use PHQ-9 very frequently, and it can be a big task to do, but just a simple question: over the last 2 weeks, have I been more sad than happy? And if the number comes out high, then you need to talk to an expert.
Then just call me.
Sorry?
Then just call me.
Call Dr. Shah.
I don't accept new patients.
The local resource. So one thing, when I started the Muslim mental health work, there were 3 major goals that I started with. One thing was awareness. Okay, what is mental illness? Second thing was acceptance, that we all are part of that 1 in 4 number. Then third thing was how to improve access. But I think what role I see that Ibn Sina and other big organizations can take over is advocacy. Policy, how can we impact the policy, right? So, but I would say this work starts that each one of you are a stakeholder, be it media, be it physician. I'll give you one thing that's very scary and concerning, that the more, how the stigma plays out, that the more the vulnerable population, like right now, Muslims are identified as the most vulnerable faith community. The more the vulnerability, the less access they have. Why? Because of the stigma and shame. On the other hand, we don't have services that are culturally, religiously matching with our needs, but the stigma also keeps them from accessing care. So other thing I tell you, all of you want your kids to be physicians, but you know what is the most scary thing right now? That there is 1 to 2 doctors completing suicide every day in this country. So I would say we just need to step back and take a fresh approach. And it starts with us. Are we doing mentally well? Every time you get irritable, angry, scream at someone, get upset on your kids, husband, wife, wherever, work, colleagues, that's the time to sit back and say, what's happening here? Because another thing with the imams, especially that we are doing the work, is compassionate fatigue, the burnout rate. Because the imams are now not only religious leaders, they are our political face, they are our community face. It's more than they are ready to take on. And not every Islamic center is equipped to support them in this work. I'll give you a joke and pass it on then for further question. So my imam and I, we worked very closely. There was a postpartum psychosis case. Instead of calling me, they called the imam at 3 a.m. in the morning. So he called me in the morning and said, "Sister, you should have been the one there." I said, "At 3 a.m., I'm glad it was you, brother, that they called." So I think we need that kind of relationship. We need that kind of openness, and we need that kind of relationships. Just one last thing, and after that, don't give me the mic. One thing that cardiology or brain specialists would tell you, that the human body is very resilient, right, in some ways. So if your main blood vessels get blocked, the body has the capacity to develop collaterals. And that's how I see the community. That even if your main source of support is not there, if your parents, your finances, education, if something is missing, this is your collateral channels. Community has that kind of power to sustain and support you. Thank you.
So I'll share with all the respected, esteemed attendees today a personal experience that took place this past Friday. And I'm sure experts in the field will tell us that mental health illness does not necessarily have signs that are observable by everybody around. This Friday, I attended a service for a colleague who passed away last Sunday. We saw this colleague the Friday prior to that Sunday. Normal, active, performing on a job. So this Friday, I attended the service, and when we're done, we're meeting everybody from work. And I said did he have a heart attack? I said, no. His daughter posted on Facebook that he had a mental health issue and he took his life. Now, I share this with you today because nobody at work observed any signs that indicated this person had a mental health issue that he's dealing with. Nobody. Friday was a normal day. All that to say is, it's going to take more than the imam or the doctor or the leader in the mosque to recognize these issues, to connect and bridge the gap and make sure that we're all connected to address this problem, including the families. We have to be forthcoming, we have to speak about it and seek help. I just wanted to share that personal experience because I was taken aback myself. Could I have done anything different, but I did not see any signs. So it's a real problem and we have to be cognizant of that. Thank you.
What an important point.
Can I say one sentence? There is a need to strengthen the relationship between the patient and the doctor in this case. I know the corporate reasons are there, but we have to think over it also.
Yeah, absolutely. So I want to focus, I missed the morning sessions, so this might have been talked about. We've talked a lot about young people, we talked a lot about community, we've talked a lot about the role of different people in the community and our individual responsibility. There's a part that I think is very important that affects many of us. It's the seniors in our community, the elderly in our community. And oftentimes, in their last days of their lives, their quality of life begins to decline. And it's not just a physical health issue, it's more and more of a mental health issue. And so I want to I think we're kind of coming to the end of our session, but I'd like each of you, from your perspective, from where you sit, to take a minute to talk about that element that we're all facing.
Yeah, very important topic, and since we have very little time. So the thing we miss when you talk about our elderly folks, our parents, grandparents, the couple of things we miss about that. First, the most common thing which we miss in our elderly parents, grandparents is memory issues. A lot of our parents, grandparents may have memory problems, dementia or Alzheimer's, which is a subset of dementia. And we don't think about it, we don't talk about it, which is the cognitive disorder. And we think their long-term memory is good and they're fine. Their long-term memory may be completely fine, but their short-term memory, which is what happened yesterday, last week, is not good. We need to focus on the short-term memory. Are they able to take the medications? Are they able to do regular chores? We need to take care of those things. And if we find those signs and symptoms, we need to do simple things. For example, power of attorney, medical power of attorney, medical decision-making. All those things need to be taken care of. They don't need to be alone. They don't need to be driving. They don't need to be cooking because if they're alone and they cook, or especially say gas stove, the whole house can burn. So simple things like that. So focus on short-term memory as opposed to long-term memory and think about your elderly parents or grandparents. That's our elderly folks. And dementia is an age-related disease. The more you grow older, the more it is common. So that's the most important thing for elderly. Elderly folks have depression, which is very common. Sleep disorders are very common. But the most common problem with elderly people are cognitive disorders, and they don't need to be left alone. So that's the only thing I will suggest in this short period.
As people get older, they spend more and more time with their television. When they're younger, when they're older, right? Talk a little about, from your perspective, what's needed on that screen.
I think the main issue is the loneliness. Even they are watching the television, they are alone because the children are busy and they are not giving them the time. You see that if the research says, the statistics say that the people who are spending more time on less time on the television or on the screen, they are, less alone, or they are less having afflicted with anxiety or the chaos. So the solution, to my point of view, is that they should be given the company, they should be given, they should be kept busy, and they should, the television should present more dramas and the news which should not portray more crime, more violence, and more loneliness things. And it should be, and the television should not portray the reaction to the loneliness or the mental illness issues.
We're closing our session quickly. So if you were going to get advice to people that have parents or other elderly at home, how should they talk to them? What's just tactically, what are the things?
I think, as Dr. Shah mentioned, beside that, I think one important piece that's missing in our communities is we never have end-of-life issue discussion with our parents. Although, again, going back to Islam, making a will is mandatory, right? So making a will is mandatory. So I think that's such an important thing as we have a geriatric population in our communities that are growing old. And unfortunately, we have a situation where we do not have enough resources to engage them. We don't have senior centers that they can go and get culturally appropriate kind of entertainment. And I think the thing that they fall on is then watching TV. But I think only short piece advice would be that have that end of life discussion, because what we are running into, I'm a geriatric psychiatrist, what we are running into that situations like who makes medical decision for you, or DPOA, or who's gonna, but what are your wishes? Do you want to be a DNR, or you want to be put on a vent? All that our parents are not familiar with. One thing with dementia, it's not a disease of an individual, it's a disease of the family. It sucks down the family as well. So be aware of what dementia is, what are the resources out there for dementia patients, and I think that would be my concern.
From the massager standpoint, what are the things we need to do to support the seniors that we have, either living at home or living on their own? We have both.
It's an excellent question, Mustafa. We come across many cases of seniors who do not have a right to go to Friday prayer. That's a problem in our community. We don't have this social conduit and a conducive environment for our seniors to have a social life. That is a problem. Every Islamic center, and we do have a couple who are making strides, need to have a senior social club where seniors come together, have some time to socialize and engage and pray and attend the prayers. So as a community, we need to check on one another. We need to make sure our seniors have plans. If we have seniors in senior living areas that don't have avenues to get to prayers, let's volunteer to do that. If we do not have senior programs in our centers, it's about time we talk about that and make sure that our seniors have an environment where they don't feel that they are secluded from the larger society. So it's very hard for us to talk about Muslim-assisted living and senior housing and all of that. There's a lot of capital involved in that, and it's a discussion that we've been having in the Muslim community for many years. But until we get there, there are many things that each and every one of us can do and must do to make sure our seniors population is taken care of, inshallah.
So as we wrap this panel up, I think the biggest walkaway from this is that each one of us has a role in this. At home, in our community, in our massages, in our workplace, wherever we are, we should be ambassadors of this to alleviate suffering that people often find themselves alone in.
Absolutely.
So with that, please give our panel a warm round of applause. Thank you so much. I got a sticker that said we're over time. So we will end this panel, and I know there's so much to talk about, and they'll be here to continue the conversation.
So now we just have our last two remarks to wrap up our conference. I'll actually ask Dr. Asim Shah to come up and give some closing remarks, followed by Mr. Ayman Kabir, and I'll pass it over.
Thank you. So, last few remarks. So first of all, how was our MC today? She gets an Oscar. Really, she gets an Oscar from me. She was amazing in spite of all the, special guests coming in and out. She was amazing. So really and truly, you were amazing. Thank you very much. A lot of suggestions came throughout the day. A lot of people stopped me, talked to me. A lot of good things. I haven't heard any negative things except for the fact that time was too short. We should have a longer conference. We should have people came and said, Dr. Banu's presentation should have been an hour. Other presentations should have been an hour. Breakout sessions long. I mean, people wanted to hear more. When we thought about this conference, honestly, me and Nasrubhai were thinking, people would be gone after 12. How do we keep people engaged? And mashallah, people are here. So truly, this is all a testament to you all's interest, but really the speakers, really everybody did amazing job. And this really and truly, every credit goes to Nasrul Rabbani. Mr. Rabbani has done an amazing job. And his whole team, where is Liaquat? Liaquat, amazing job by Liaquat, Adil, the whole board of directors of Ibn Sina. They all have done an amazing job, amazing job. But I'm here to talk about a way forward. What did we hear? What are we going to do in terms of mental health and all? So throughout the conference, I was thinking of FOMO, which means fear of missing out. What did I miss out today? What topic I'm going to miss out? And that stuck to my head throughout. A lot of important things came out today, really and honestly. Dr. Banu's lecture was amazing. Dr. Mukaddam's lecture was amazing about addiction. Congressman Attorney General Keith Ellison talked about guns, and I really and truly think it's a very important topic, and I was not only amazed, humbled, but happy to see the whole room clapped when he talked about guns in Texas. That was really amazing. That was really amazing, honestly. Why? Because America, USA, has the most guns in the world, and we have more guns than the number of people we have in the country. And as a psychiatrist, I truly believe that that is a problem. But anyway, that's a separate issue. So what we did today is that we wanted to create awareness. We did that. There are people here, more than 300 people, stayed there the whole day. Amazing. We created not only awareness, but the interest. And the interest is contagious. People are here, people stayed here, people were texting people were taking pictures, posting on Facebook. That's how it goes, right? So we created awareness. It is contagious. People are talking to people. I've seen people using the word, it's a movement. People are talking to each. So that was the number one goal. I think we have achieved it. So great. Interest is there, acceptance is there, awareness is there, all of that is good. Second was advocacy for mental illness stigma. I think stigma is an ongoing problem. It cannot be solved in one day. I have said it multiple times. Those people who know me know that I say it all the time. The word mental health has stigma in it. And until we change that word, stigma will stay in there, of course. So we will continue to talk about it. The fact that you all stayed 6 hours, we will continue to have a yearly conference through Ibn Sina's blessings. We will have even quarterly conferences. We will have webinars. Brother Kabiri mentioned we will do different educational sessions for ISGH, for other organizations. Anybody wants to do anything, I'm happy to do it. Others are happy to do it with the Children's Mental Health Conference, with Fort Bend County. With us. We'll continue to do whatever educational conference we do. We do everything. I do everything like that free. My colleagues will do it free. We will do all of those. Whoever wants, we will continue to do it. So that's, never charge a single penny for that. We'll continue to do that. But that is the advocacy, the education, we'll continue to do that. Access to care. I always believe that access to mental health care needs to be not only for everyone, not only rich, the rich can get access to everyone, but also early access. So for that, we are lucky that we are in Houston. Houston has a lot of good access, which could be Harris Center, which could be Harris Health, which could be Legacy, which could be Ibn Sina. You can have access, early access in Ibn Sina for mental health, whether it's therapy, whether it's psychiatrist. Ibn Sina psychiatrist is sitting here. So we can have access. So it's not an excuse that if you or your friend or your neighbor or your cousin or your uncle, anybody has a mental health need, they cannot have access. They certainly can have access. There is no excuse not to have an access. So that's another thing. People talk about having these conferences yearly. We should, of course, have it yearly. Resources. Resources are in the packet because people tend to forget the resources. One number always to remember, of course, 911 everybody remembers, but the other number to remember for mental health is 1-800, everybody remembers 1-800-273-TALK. T-A-L-K, TALK, okay? And lastly, one thing which came overwhelmingly a theme from people is that this year we didn't include 2 topics. We should include next year. One would be something about postpartum depression, and the second would be about seniors and maybe Islamic will. So we'll keep that consideration in mind and hopefully do something about that. Thank you very much. Thank you for everybody's participation. Really appreciate it. Thank you.
Thank you. Thank you so much, Dr. Shah. And I will accept an Oscar if that's actually an option. So please submit that for the committee for consideration. Yes. I said I will accept an Oscar if it really is an option. Excellent, excellent. So before I invite our closing speaker, I do have to do the MC work of lost items, just briefly. So again, we have these glasses here, these black glasses, if anybody has lost them. Also, I had a really funny story. It would not be a Muslim event if someone did not lose their shoes during prayer. So I encourage you just to look down, brothers, to your shoes to make sure they are indeed your shoes, because we have a pair of black shoes that have been swapped, unfortunately, size 7.5. So if you do have those shoes, I will spare you the walk of shame on top of the stage, but please see me after this so that we can rectify that issue. So apologies for that levity, but it is the reality of such is life. Now, as we wrap up our conference, I'd like to invite Mr. Ayman Kabir, the president of ISGH, to close out our conference before we also celebrate our volunteers.
Assalamu alaikum wa rahmatullah. We begin in the name of Allah subhanahu wa ta'ala, bismillah ar-Rahman ar-Rahim. I'm supposed to do a vote of gratitude and thanks to each and every one here and close with a dua, but I may just request Imam Tawqir Shah, inshallah, if you come up. I can't vocalize this dua when I have religious leaders in our presence, alhamdulillah, to vocalize it the way we want it to be vocalized, inshallah. So I want to just begin by thanking participants, each and every one of you, for taking time out of your busy schedules to be here today. Not only to get the awareness of mental health issues in our plan forward, but to be an advocate on behalf of our respective communities. Alhamdulillah. So Jazakumullah khair. On behalf of the Ibn Sina Board of Directors, on behalf of the Core Committee for the Muslim Mental Health Conference, on behalf of the organizing organizations, we want to thank you for being here today, alhamdulillah. You have made this first conference a successful one. May Allah bless you all in health and wealth. Now, this is indeed the first step in a journey that we will all take together. And together it is. It is not going to be the responsibility of organizing committees or religious leaders or administrative leaders. As I mentioned, each and every one of us is a leader in the community, and we'll go back and we will be advocates for this cause, a noble cause indeed. I just want to share that our purpose of this entire conference, and when Brother Rupani and Core Committee came forward and really put this as a journey for an answer product for the Muslim community, the purpose primarily is to strengthen our community leaders to go back and make sure that we have a healthy community. A healthy Muslim community, not just within, but also a community that will be healthy, and we will influence the society around us to be healthy as well. So commend Brother Rupani, Ibn Sina Foundation, organizers, core committees for, subhanAllah, the swift action to respond to this, call it pandemic, epidemic, whatever that word is, because it is real. We're dealing with it in our communities every day, and we are now in a journey, inshallah, to address that. Brother Rupani and the team at Ibn Sina have done a phenomenal job, mashallah, over the past months. It took months, by the way, to get this conference together. A lot of work in the background to ensure that we have the sessions we had today, alhamdulillah, so give them a round of applause, please. We're once again very thankful for each and every one of you for your presence here. That being said, we'll ask Imam Tawqir to come up, inshallah, and give us the dua. I'll just say that I personally ask Allah subhanahu wa ta'ala to grant us health from the ailments of our hearts, the ailments of our bodies, and the ailments of mental health issues. That's what I would ask Allah subhanahu wa ta'ala to grant us today. That being said, we'll pass it on to Sheikh Tawqir. There are few vendors, mashallah, who made an impact and supported this conference, not only by their presence, but also had an impact on us being here today. We're talking about Devon Bank, National Alliance on Mental Health Illness, and also Guidance Residential. So thank you for your presence and support. Jazakumullah khair. Assalamu alaikum wa rahmatullahi wa barakatuh.
Jazakumullah khair, Brother Ayman, thank you so much. And Jazakumullah khair, Brother Nasruddin Rupani and Dr. Asim Shah and all of the executive core members, the organizing committee members. May Allah subhanahu wa ta'ala bless all of you for the first Muslim Mental Health Conference, the first of many, inshallah. We look forward to many of these conferences here, inshallah, in our greater Houston area. Join hands as we make dua. Bismillah ar-Rahman ar-Rahim. Allahumma salli ala Sayyidina Muhammad wa ala ali Sayyidina Muhammadin wa barik wa sallim. اللهم صل على سيدنا محمد وعلى آل سيدنا محمد وبارك وسلم يا الله يا حي يا قيوم يا ذا الجلال والإكرام يا رحمن يا رحيم يا رب العرش العظيم. Oh Allah, we ask you to accept this effort. Ya Allah, we ask you to accept this noble effort. Ya Allah, we ask you to bless all of us and to protect our community members and everyone who is suffering from mental health illness. Ya Allah, we ask you to heal our community. Ya Allah, bless us with shifa. Ya Allah, make it easy for us and make way for us to move forward with such illnesses. Ya Allah, we ask you to bless every member of our community and our society. ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار. ربنا تقبل منا إنك أنت السميع العليم وتب علينا إنك أنت التواب الرحيم. سبحان ربك رب العزة عما يصفون وسلام على المرسلين والحمد لله رب العالمين. جزاكم الله خير. بارك الله.
And now I'll just wrap it up finally. If there's a QR code on your table that you should find that will have an evaluation of today's event, as many of our speakers shared, this is the first of many, inshallah. And I know I have many volunteers here that will be helping us do the next conference. I'd also like to invite our volunteers to the stage for a photograph and to receive some certificates for your efforts. Let's have one final round of applause for everyone who made this conference possible, and may God bless you all in all your efforts.